Let me acknowledge the physical presence. Wala na. Sa online, wala pa po. Anyway, today we have on our agenda the bills establishing regional and satellite branches of specialty hospitals filed by Senate President Mig Subiri, Senator Sani Angara, and the bills establishing specialty centers in existing DOH hospitals filed by Senator Pia Cayetano, Senator J.B. Ejercito, Senator Chis Escudero, and this representation. We're also taking into consideration the bills of Senator Amy Marcos establishing Philippine Heart Centers and other specialty hospitals in Visayas and Mindanao. May we now request the COMSEC to acknowledge the resource persons who are with us today. Mr. Committee Secretary, kindly.
Good afternoon, Mr. Chair. For the public hearing on regional specialty hospitals, we have the following resource persons. From the Department of Health, we have Undersecretary Libet David. She's online. From the Health Policy and Infrastructure Development Team, we have Dr. Melissa Sena, Medical Officer 5 of the Health Facility Development Bureau, and also the Interim Chief of the Philippine Cancer Center. Director Maria Teresa Vera, the Director 4 of the Health Facility Development Bureau. From the Philippine Heart Center, Dr. Joel M. Abanilla, the Executive Director. From the National Kidney and Transplant Institute, we have Dr. Rose Marie Rosete Liquete, the Executive Director. From the Lung Center of the Philippines, we have Dr. Vincent M. Balanag Jr., Executive Director. From the Philippine Children's Medical Center, we have Dr. Sonia V. Gonzalez. She's online. She's the Executive Director. And she has COVID, sir. So she's joining online. We also have physically present Mr. Anthony Emmanuel Garcia, the Planning Officer Head for Corporate Planning, and Ms. Julie Marie G. La Fortesa, the Project Development Officer 4. Virtually attending also are from the Department of Health, Director Leonita Gorgolon, from the Health Policy and Infrastructure Development Team, Wapa Bibilao, Development Management Officer 3, Health Facilities Enhancement, Hevander Homol, also from the Health Policy and Infrastructure Development Team, and Arvin M. Matias from the Health Facilities Enhancement Program. We also have Roby Vargas Miranda, also from HFEF, or the Health Facilities Enhancement Program, Lisel N. Uy, also from HFEF, and Gerald D. Garbosa, also from the HFEF. From the Department of Finance, from the Bureau of Internal Revenue, we have Attorney Ron Mikael Uy. From the Department of Budget and Management, Assistant Secretary Cristina Clasara, Mr. Jus Rex Abejero, and Mr. Carlos Borja Jr. From the Philippine Medical Association, we have Dr. Maria Lilibet Pascual Nagit, PMA Governor for Quezon City. We also have Dr. Cesar M. Ong, the Vice President of the Philippine Pediatric Society. We have Dr. Maria Elizabeth de Bosura, Executive Director of the Philippine College of Physicians. We have Dr. Diana A. Payawal, the President of the Philippine College of Physicians also. Dr. Ramon Inso, President, Philippine College of Surgeons. And Dr. Maria Concepcion C. Besagas, Vice President, Philippine College of Surgeons. We also have from the Lung Center of the Philippines, Dr. Sulian S. Naval, the Deputy Executive Director for Medical Services. We also have from the Office of Congressman Sato, the Chief of Staff, Attorney Rachel Darigay. Kalimag. We also have now, just online, Dr. Maria Minerva P. Kalimag, the President of the Philippine Medical Association. That would be all, Mr. Chair.
Salamat, COMSEC. The COVID-19 pandemic has laid bare the vulnerabilities of our healthcare system. And as reminded us to consider the importance of improving the resilience of our communities and the systems on which they depend. Ngayong patuloy pa rin ang nating nilalabanan ng COVID-19, hindi pa rin dapat mailayo sa ating mga isipan kung paano natin mas mapapalakas pa ang ating healthcare system sa bansa. The more we should invest sa ating healthcare system, nabigla tayo nitong nakarang pandemya. Sino ba namang hindi na nabigla? No, nabulaga tayo. Kaya habang patuloy nating nilalabanan ng COVID-19, hindi pa rin dapat may layo sa ating isipan kung paano nga papapalakasin pa, dagdagan. At of course, no, pagkakasyahin natin kung yung pera ng gobyerno sa priorities po natin sa ngayon. Last Congress, one of the priorities of the Committee on Health and Demography was capacitating our health facilities. Towards this end, we successfully pushed for the enactment of 69 laws which sought to increase the bed capacities and upgrade the capabilities of select hospitals, as well as establish new medical facilities in various provinces throughout the country. Sa dami nga ng pinupuntahan kong pampublikong hospital, even before the pandemic, minsan sa koridor, isang kama, dalawang pasyente nagsisikipan. Lalo na ng panahon ng pandemya, bawal magdikitan. So talagang mas hirap ang ating mga kababayan, lalong-lalo na po sa mga pampublikong hospital. Dahil yun po ang takbuhan ng mga kababayan nating mahirap. Hindi naman po pupunta mga mayayaman dyan. We also learned during deliberations last Congress that some hospitals reach as high as 400 bed occupancy rate. We also initiated the establishment of super health centers in strategic areas to be able to improve access to primary care and basic medical services. Marami pang mga munisipyo na kulang talaga ang pasilidad. Wala sila kahit na rural health unit. Ito pong super health center, mas malaki lang po ito sa rural health units na maaaring magserbisyo sa isang distrito. Mas maliit sa hospital pero nakalagay sa mga strategic areas para hindi na nila kailangan bumiyahe pa po sa malalaking hospital para sa basic medical services. Napapansin ko talaga yung iba, they have to travel 200 kilometers away. Minsan patay na yung pasyente pagdala nila doon sa mga hospital. Kung mga emergency cases, birthing facilities na pwede naman po makiter ng mga rural health units or super health center, masaya po ako na priority po ng DOH ang ating mga super health center. Natutuwa po yung mga kababayan natin sa malalayong lugar, liblib na lugar, yung mga rural areas na halos hindi nila masulyapan. Remember, more than 1,000 municipalities po tayo sa buong Pilipinas. Marami po dyan na walang sariling hospital at napakalayo. 2, 3, 4 hours ang travel nila papunta doon sa mga provincial hospital or regional hospital. Kaya masayang-masaya po sila na meron na po silang super health center na sila pong maaring magpatakbo o mag-manage dahil ito po ay pwedeng birthing facilities, dental, emergency, minor cases sa mga pasyente. Talagang nakakatulong po ito sa mga mahihirap. I am glad that President Marcos is supportive of this program. Ito pong pagdadagdag ng mga specialty hospital as he announced in his first State of the Nation address that this administration intends to bring these kinds of centers closer to the people. Nang sa gayon, magiging mas madali sa mga may karamdaman na magpapagamot ng hindi na kailangan magbiyahe ng malayo. Habang pinapalakas natin ang iba't ibang pampublikong hospital at naglalagay tayo ng super health centers sa strategic locations, isa rin po sa dapat nating pagtuunan ng pansin ay kung paano mapapalapit ang ating specialty hospital sa ating mga kababayan. Kaya po tayo naririto para talakayin ito. These specialty hospitals are some of the best in our country. They provide quality and affordable healthcare. However, all specialty hospitals are situated in Metro Manila. Kaya marami sa ating mga kababayan ang namamasahe at pupunta pa ng Maynila para lang makapagpapagamot ng malubhang mga sakit. Dagdag pa sa isipan nila ang transportasyon at accommodation costs. Totoo po yan. Yung iba, lumalapit po sa akin, humingi ng tulong, papa-hospital, papa-opera sa Maynila. Isa sa iniisip nila, saan ba kami titira? Yung pamasahe, napakamahal. Yung iba, nagdadalawang isip. Kaya ina-assure ko naman sila, we have very good hospitals po na napakagaling, kumpleto, tulad ng NKTR, Heart Center, Philippine Cancer Center, napakarami pong pasilidad. Kaya lang, Lung Center, Philippine Heart Center, kaya lang po, nandito sa Metro Manila. Ina-assure ko sila, nandito naman po ang gobyerno na handang tumulong po sa kanila sa abot ng ating makakaya. Kaya kung yung iba po, namamatay na lang dahil hindi na nila nadadala sa Manila dahil na po sa kahirapan. Talagang napakahirap po na maging mahirap, kaya tulungan po natin ang ating mga kababayan. Hindi lang naman po sa Quezon City merong may sakit sa baga. Hindi lamang po sa Metro Manila ang mayroong sakit sa puso, hindi lamang po sa Luzon ang may sakit sa kidney. Kaya nung panahon po ni dating Pangulong Duterte, napakarami lumalapit po sa amin, hindi lang para sa magpapagamot, humihingi po ng pamasahe para bumiyahe. At kasi po nandito yung mga specialty hospitals na kayang gumamot sa kanila. Kaya nga, sabi ni Pangulong Bongbong Marcos sa kanyang State of the Nation Address, napakinabangan natin ng husto ang malalaking specialty hospitals gaya ng Heart Center, Lung Center, Children's Hospital at National Kidney and Transplant Institute, NKTI. Kaya maliwanag na hindi lamang dapat dito sa National Capital Region, kundi maging sa iba't ibang parte ng bansa kung kailangan magdagdag ng ganitong uri ng pagamutan. Tama po si Pangulong Marcos, kailangan ilapit sa mga kababayan natin ang mga specialty hospitals, kailangan ilapit sa tao ang serbisyo ng gobyerno. Ito rin ang dahilan kung bakit ko po isinulong yung malasakit centers para ang gobyerno na po ang lumapit sa tao. Based on my experience talaga yan, na wag po natin, tulungan po natin ang ating mga kababayan, wag po natin silang pahirapan pa. Lalong-lalo na po yung mga mahirap. Sa pagkakaroon ng mga dagdag na specialty hospitals, maging sa labas ng Metro Manila, hindi na mahirapan ang mga Pilipino kahit nasan man silang sulok ng bansa dahil mas mapapalapit na sa kanilang specialty hospitals. Kung tutusin, sabi ko nga, pera po nila ito, ibalik po natin sa kanila sa mabilis na serbisyo. Ang dami pong pumipila sa mga specialty centers natin. Pagkaalam ko, talagang punuan, Heart Center, pumipila sila, NKTI. At ang daming humihingi ng tulong sa akin, sa opisina ko, even sa opisina ni Senator Raffy Tulfo, marami rin pong humingi ng tulong sa pagpapagamot ng puso at kidney. Kaya itong mga Lung Center, Heart Center, NKTI, ito po ang lapitan talaga dahil sila po yung mga specialty hospitals na mga run by government. Kadalasan talaga ay mahirap po ang pupunta. Hindi naman po pupunta mayayaman dyan halos sa mga pampublikong hospital. Republic Act 11223, known as the Universal Healthcare Act, aims to ensure that all Filipinos are guaranteed equitable access to quality and affordable healthcare goods and services. As mandated by the UHC Act, healthcare provider network shall be established by the Department of Health to ensure effective and efficient delivery of population-based and individual-based health services. These networks shall efficiently deliver coordinated and continuous healthcare from primary to tertiary level with linkages to an apex or end referral hospital and other facilities providing specialized services needed by its catchment population. Alam na natin ang pangangailangan. What we want to know in this hearing is the proper, cost-efficient, practical, and time-saving approach in establishing these specialty hospitals. Should we establish new branches of our specialty hospitals in other regions, or is it more efficient to upgrade existing regional hospitals, considering that the healthcare experts in the regions and other personnel are already available and accessible in these hospitals? What would be the role of our existing specialty hospitals? Halimbawa lang po, ang sa SPMC sa Davao. Pagkaalam ko, maganda po yung pamamalakad doon. Meron na hong mga cancer center, meron na hong heart center po sa SPMC sa Davao, at kumpleto rin po sila sa pasilidad. Ganun ba ang dapat nating gawin? Magdagdag tayo ng mga katulad ng Southern Philippines Medical Center na magkakaroon rin po sila ng heart center doon sa ospital, or should we establish another branch ba ng heart center ng NKTI sa Luzon, sa Visayas, sa Mindanao, o dito sa Upper Luzon at saka sa Mindanao, lalong-lalo na po sa baba na parte ng bansa na wala pong mga heart center. Yun po ang dapat nating pag-usapan na ngayon. We will welcome the inputs of our agencies, stakeholders, and experts on the best way to have specialty hospitals in our region. Ang punto ko po dito, ang napaka-importante po, mga kababayan nating mahihirap po, yung walang access, walang pamasahe, walang pambayad ng ospital, ang dapat po makinabang dito sa plano nating pagdadagdag ng specialty hospitals or pagpa-branch out ng mga specialty hospitals. Maring mas alam nyo po ang dapat gawin since you run the specialty hospitals here in Metro Manila for a long time na po. So maraming salamat. Let me acknowledge the presence of Senator Raffy Tulfo and Senator Robin Hood Padilla. Ito po'y dalawa kong kasamahan na nagmamahal rin po sa ating mga kababayang mahirap, dahil sila po'y mismo saksi at takbuhan rin po sila ng mga pasyente na nangangailangan. Maraming salamat po. Let me now start with our hearing. We will welcome any inputs. First, may I ask my fellow senators if they have any opening remarks before we proceed. Go ahead, Senator Raffy.
Manifestation of support for DOH specialty centers. Accessible healthcare has always been a problem for the Filipino people, which is made worse by our poor health monitoring habits. Up to 6 out of 10 Filipinos who pass away from illness was not diagnosed by a health practitioner. One of the primary reasons why people choose not to visit the doctor has to do with the real distance they must go in order to get themselves examined. We must make health convenient for all. In order to improve the provision of medical care to Filipinos living in remote rural areas, this administration urged for the establishment of more specialty hospitals in other regions of the nation, which we fully support here in the Senate. It is clear that in order to decentralize services in the national capital region, specialty centers must be established in the provinces. Medical treatments should be made available and inexpensive to the Filipinos countrywide, especially those living in the remote areas. In light of the rising number of diseases such as heart disease, kidney failures, lung cancers, and other illnesses that cause deaths due to insufficient healthcare facilities. In addition to being affected by the illnesses or injuries, the majority of the Filipino patients who live outside the capital region are also burdened by the additional costs of transportation and lodging. This bill will also alleviate the plight of our healthcare workers. Opportunities for healthcare professionals will be available, but we should ensure that proper salaries and benefits for them are also in place to entice them to serve the country instead of trying their luck away from their families. Pero sana ang panukala na ito ay hindi mabahira ng politika. Dapat may sapat na pag-aaral kung saan ilalagay ang mga specialty centers. Hindi porket malakas si governor o mayor ay doon na agad magkakaroon ng specialty center. Dapat sa lugar na mas maraming makikinabang na mahihirap nating kababayan. At kailangan aralin din na mga specialty centers ay may support system ng ibang medical facilities and practitioners. Napakaganda po ng adhikay na ito. Sana matupad na po ito ng tama. Makakaasa po kayo na gagawin ko po ang lahat ng aking makakaya upang may sa batas ang panukalang ito na makikinabang ang bawat mamamayang Pilipino. Thank you, Mr. Chair.
Salamat, Senator Tulfo. Senator Robin, do you have any manifestation?
Magandang hapon po, mahal na tagapangulo, sa ating pong si Senator Bongo, ang senador po natin nagbaba ng gobyerno sa tao, idol. At ang ating pong isa pang idol, Senator Rafi Tulfo, isang magandang hapon po. At sa lahat po ng ating mga bisita, magandang hapon po sa inyo. Ako po ay matagal lang tagahanga ng federalismo. Katunayan, ako po ay nasa PDP laban sapagkat yan ang kanilang adhikain, federalismo. Ito pong pinag-uusapan natin na patungkol sa pag-regionalize ng mga ospital. Ito'y hakbang sa federalismo. Sapagkat nararapat, lalong-lalo na po sa geography ng Pilipinas, na tayo po hiwa-hiwalay na 7,000 plus islands nga kababayan, literal na kailangan tumawid ng dagat para lamang sila ay matugunan kung ano man ang programa ng gobyerno, lalong-lalo na po pagdating sa kalusugan, health. Kaya ako po ay sumusuporta sa hakbangin na ito. Katunayan po, ako din po ay may panukalang batas patungkol dito. Sapagkat para sa akin, kapag ito po ay naging matagumpay, ibig pong sabihin, federalismo din ay magiging matagumpay. Kaya ito po ay nakasalalay sa inyong mga kamay. Maraming salamat po. Ako po ay nakasuporta po sa inyo. Mabuhay po.
Salamat, Senator Robin Hood Padilla. Puro idol ko tong nasa tabi. Bukod sa talagang mga idol ko sila, mga nickname nila puro idol. Kahit sa kami pupunta, tawag sa kanila idol. Idol.
Pero ikaw, idol kita.
Hindi, pareho kayo ang idol kong dalawa. Salamat, sinamahan niyo ako. We'll now hear the position and comments of our resource persons. As I have mentioned, we want to particularly know what we would be more feasible between the two proposals. Do we need to establish new specialty hospitals? Or can we just upgrade and capacitate existing DOH hospitals as specialty centers? Katulad nung sa SPMC, I think sa Cebu. Ano po ang mas makakabuti sa ating mga kababayan at mas magiging maayos ang implementasyon? At my position talaga rito is paano po natin maibaba ang gobyerno, paano natin maibaba ang ospital sa ating mga kababayan. Yung accessibility, yung pamasahe nila. Importante rito, ang mga kababayan nating mahirap po ang makikinabang. Let me hear the position of the Department of Health. Nandito rin po si DOH Yusek Lilibet David. Ma'am, are you online?
Yes, yes, Honorable Senator Bongo and Honorable Senators. Thank you very much. May I just give po the general position of the Department of Health with regard to the various bills that are being proposed in the Senate for the establishment of specialty care all over the country. So the Department of Health supports the various Senate bills which seek to establish specialty centers across every region in the country. These measures are intended to address the gaps of access to specialist care, as most specialty hospitals are located in Metro Manila, where the poor and underprivileged, particularly those from geographically isolated and disadvantaged areas are unable to access. And the DOH has really already crafted the development plan for specialty care, which is part of our Philippine Health Facility Development Plan 2020 to 2040. 16 specialties were selected as a priority based on the country's top burden of disease, existing laws and mandates, and special needs. The DOH developed the resource stratified framework for each facility level and specialty care, which defines the services and essential resource requirements necessary for each level of care. And all the DOH hospitals shall be upgraded to serve as either a national specialty center, similar to the Philippine Heart Center, Lung Center of the Philippines, and KTA and PCMC, and developing advanced comprehensive centers at subnational levels and basic comprehensive centers to deliver specialized services for specific catchment areas. All specialty centers are level 3 specialty or general hospitals that shall serve as apex or end-referral facilities at the regional, subnational, and national levels. To date, the Philippine Health Facility Development Plans has prioritized the development of 328 specialty centers for the 16 specialty centers across different DOH hospitals in all regions of the country. So the DOH really does not interpose any objection to the establishment of specialty centers across the country because we recognize the greater need for access to specialty care. And the DOH proposes that the existing DOH hospitals would be upgraded to provide access to specialty care by 2025 for priority specialty care. The reason, Honorable Senators, is that the new construction of single specialty hospitals requires a longer time and a higher budget, and also for the capacity development of the human resources to be manning these hospitals. So even as we project to have sometime in the future single specialty hospitals in various regions of the country, we need to prioritize access now in the soonest possible time for specialty care services for our people, particularly for 2025 for the specialty care services mentioned by President Bongbong Marcos in his SONA speech. So the DOH hospital proposes that the DOH hospitals designated as specialty care centers for specific specialties in subnational areas and regional areas will develop their plans consistent with their designated specialty service capacity in order to access the capital outlay investment and the other sources of funds from government or through official development assistance. We also need to do this so that we can program the adequate number of specialists and the role of other agencies in the production and training of health workers. Our specialty centers, the Lung Center of the Philippines, the Philippine Heart Center, the National Kidney Institute, Transplant Institute, and the Philippine Children's Medical Center have been the pioneers in developing specialty care across our regional hospitals to provide specialty care to our people. And we are expanding this now for the top 16 specialty care. And then after 2025, then we will be developing the specialty care for other concerns. Senator Bongo and our other honorable senators in the meeting. We have our experts also in the Senate to answer any questions that the committee has. Thank you very much.
Salamat, Yusek David. Meron lang po akong tanong, no? Can you explain the difference between a specialty hospital and a specialty center? Gaano kalaki po ang specialty center na ito? Do we need to construct separate buildings for these specialty centers in DOH hospitals? Paano tayo makasiguro na kayang i-accommodate ang mga pasyente kung isang unit lang po ito ng hospital? Yun po ang dapat nating talakayin sa ngayon. Since we have four, I think, itong Cancer Center, NKTI, Lung Center, Heart Center dito sa Metro Manila, meron na tayong pagbabasihan sa pag-establish. Ilan na ho ba ang DOH hospitals ngayon na merong mga heart center katulad ng SPMC? Meron silang tinatawag na heart center doon. Ilan pa ba sa buong Pilipinas na merong mga heart center din po? Meron ba sa Visayas, sa Cebu? Meron ba sa Zamboanga? Meron ba sa iba pang parte ng bansa? Meron ba mga cancer center doon?
Yes, Senator Bongo. So let me start first po sa specialty centers. If we call it a specialty center, this refers to a unit or a department in a hospital that offers specialized care addressing particular conditions and or providing specific procedures and management of cases requiring specialized training and or equipment. On the other hand, if we say a specialty hospital, it's an entire hospital that specializes in a particular disease or condition or in one type of patient. It may be devoted to the treatment of any of the following. So pwede po siyang maging treatment of a particular type of illness or condition. An example of this would be the Philippine Orthopedic Center, the National Center for Mental Health. For the other kind is the treatment of patients suffering from diseases of a particular organ or groups of organ. An example of this are the Lung Center of the Philippines, the Philippine Heart Center, the National Kidney and Transplant Institute. And the third kind po is the treatment naman of patients belonging to a particular group like children, women, elderly, and others. So examples of this po is yung ating Philippine Children's Medical Center, National Children's Hospital. So the main difference po is the specialty center is located within our large level 3 hospitals, and kung specialty hospital po, it would be a standalone hospital that would have to be developed to cater to a particular disease or condition. So we already have identified various specialty centers for the different DOH hospitals across the country po. So we've divided the country for two segments in Luzon, Luzon A, which is really Region 1, 2, and CAR. And most of our specialty care are being developed in Baguio General Hospital and Medical Center and Mariano Marcos Memorial Hospital and Medical Center. For the second segment in Luzon po, which we call Luzon B, encompassing Region 4A, Region 4B, and Region 5, we have been building specialty care capacity in Bicol Regional Teaching and Training Hospital, Batangas Medical Center, and Bicol Medical Center. For the third po, for Visayas, encompassing Region 6, 8, 7, and 8, we have been building specialty capacity for Vicente Soto Memorial Medical Center and Western Visayas Medical Center. And for Mindanao po, encompassing Region 9, 10, 11, 12, and 13, and BARM, we have been building specialty capacity in Southern Philippines Medical Center and Northern Mindanao Medical Center.
Salamat. Paano natin ang mga training ng mga specialista dito sa mga specialty centers po? And then in establishing these specialty centers, we are also in effect increasing the bed capacity of these hospitals, Yusek David.
Yes, yes, Senator. So when we establish specialty centers, we primarily increase the service capability. And the service capability, as we've seen in the examples po of Philippine Heart Center, PCMC, Lung Center of the Philippines, and NKTI, they have been developing the human resource specialty capacity across the different DOH, designated DOH hospitals for their specific specialty care. And Your Honor, may I also invite that the different executive directors of the specialty care can share how they build the capacity of the different specialty care across the country.
Salamat. May we now start with the Lung Center of the Philippines? Dr. Vincent Balanag, sir.
Mr. Chair, Senator Bongo, Senator Rafi Tulfo, and Senator Robin Padilla, thank you for this opportunity to express our views regarding the establishment of the Regional Satellite Special Center. The Lung Center of the Philippines was established through Presidential Decree 1823 in January 16, 1981, to provide the Filipino people state-of-the-art specialized care for lung and other chest diseases. It's a GOCC and an attached agency of the Department of Health. The Lung Center of the Philippines provides specialized services to thousands of patients coming from all over the country, although the majority come from nearby regions, namely NCR, Region 3, and Calabarzon. In many instances, patients are forced to come to LCP to seek specialized services not available in their areas. As you have mentioned earlier, usually requiring huge effort and expense on the part of the patient and their family. But more often, people without the necessary resources have no recourse but to endure their sickness or receive less than ideal treatment for their condition. The Lung Center of the Philippines has already been designated by the Department of Health as the apex hospital for lung care services and is mandated to assist in the establishment of regional lung centers that will be capable of providing specialized pulmonary care to patients within their respective catchment area. As envisioned by the DOH, these regional centers will be part of a network of medical facilities from primary to tertiary level throughout the country, which has served the needs for lung care services of the population. Indeed, the groundwork for the realization of this network has already been started and will definitely be pushed forward at a faster pace with the enactment to law of any or a combination of the various Senate bills proposed to the body. The various Senate bills will strengthen and give the force of law the mandate already given to the DOH and the LCP and the other specialist centers, and assures that funding is made available by the national government to see the programs to its full implementation and attainment of its goals. As mentioned, there are two possible models for the development of satellite specialty centers in the different regions. The first model, which the Lung Center followed, is the creation of new hospitals with mandates similar to the different four corporate specialty hospitals. This allows the hospitals to concentrate on a particular type of specialization, allows the development of unique services that are not normally available in the regions, and avoid duplication of services already available in other hospitals. However, development or even just the recruitment of qualified specialists in the field will take time and even deprive other hospitals of their existing medical experts already practicing in the area. The initial funding for construction and equipping of these hospitals will be huge and may divert funds already earmarked to existing medical facilities. Sa lung center po, it was established through a donation, for example, of the National Housing Authority. It was built, the building and the equipment was through the help of the PCSO, and even our human resources, initially, nakuha po yan sa QI. Almost the entire staff of QI was transferred to lung center. Kaya nagkaroon ng lung center. So if you think that another lung center elsewhere would probably involve the same problems. The second model, of course, which the DOH is actually pursuing, is to identify medical facilities who have existing expertise and equipment that can be further developed into regional specialty centers with proper planning and funding. This model of implementation will not disturb operations of existing hospitals, but will actually encourage expansion of their services through acquisition of newer and more specialized medical equipment and training of personnel in more specialized fields. The process does not require a huge initial appropriation and may be implemented over a period of 5 years through careful planning and implementation. Yun lang po, Mr. Chair. Thank you.
Salamat po, Dr. Balanag. May we now hear Dr. Joel Abanilla, Executive Director of the Philippine Heart Center.
Good afternoon, Honorable Senators. Earlier on, I requested that you be given a copy of my presentation so that you can follow. It will be shown on screen also. So that will not be a problem. But sana, if they have the copies, please. Sinong wala? Kay Senator Tulfo. You have? Okay. Who else need it? Okay. So let us go to the first slide, please. This will not be a very long presentation. This is the top 10 causes of death in the Philippines. Out of the 10, 4 are cardiovascular. No? Number 1 is ischemic heart disease. No? These are the patients who come to us with chest pain, yung mga heart attack. No? And then followed closely by cancer and cerebrovascular, yung mga stroke. And then on the 5th is hypertensive diseases, tapos other heart diseases on the 7th. So put together, there are almost 50% of death rates. So bawat may dalawang namatay, isa dyan, sakit sa puso. So ganyan siya karami, no? And this is worldwide. And this was appreciated by our president. That is why the first specialty center created or built in the country is the Philippine Heart Center in the year 1975. Now, see, we are now almost 48 years old. In 2 years' time, we will be celebrating our golden anniversary. So, as sinabi kanina ni Senator Robin Padilla, no, that watak-watak tayo as a nation. So we have appreciated that, no, being an archipelago, at saka na-echo din ito ni Senator Bongo, ang hirap talaga ng transportation. I can tell you drama stories of the ordeal of different families coming all the way from the barrio and reaching the Philippine Heart Center. No, and it's an ordeal. So we have appreciated that we already thought about setting up or helping set up heart centers, whatever you may call it, regional center, satellite center, cardiology center in the region, basta with a facility that can address cardiovascular diseases. So we started this actually about 11 years ago. And I think a lot of the subspecialties are looking at us as the prototype. Next slide, please. Next slide, please. Okay. As you can see there, we have already established regional centers. Now, as of this time, we have 8 existing that can almost be called a standalone. Ibig sabihin, they have already the operating room that can do cardiac surgery. They have the cath lab. They have the TCBS surgeons. Mayroon na silang crit care specialist. At saka mayroon na silang rehab and other allied doctors that are assisting in the cardiovascular care. So, naka-enumerate yan. No? Earlier on, of course, the president comes from Davao. So, the first one that was developed was Southern Philippines, no? And then, of course, Northern Mindanao was also developed, the Vicente Soto. And then we have the Bicol Regional Hospital. And then we have the Mariano Marcos Memorial Center. And then in Iloilo, the Western Visayas Medical Center. And then in Tacloban, the Eastern Visayas. And in Baguio, the Baguio Gen. In the next page, we have also approached already and initiated all the other regions. Our plan is to establish a regional hospital, one in each of the 17 regions. So yung mga ito na-initiate na siya. As you could see, kulang pa sila sa expert personnel. Yung iba hindi pa nakadevelop ng kanilang operating room capable of cardiovascular surgery, and then wala pang cath lab, no? Cotabato was a fast track because of the enthusiasm of the people in the Muslim area. Would you believe that their ICU now can rival some of the government hospitals here in Manila, and they have an operating room and they have a high-end cath lab. Yes.
If I may, Dr. Joel, no?
Yes.
Ang tanong ko lang po sa inyo, habang wala pa itong mga bills na i-file and even before the SONA, ito na yung ginagawa ninyo
Yeah,
na
we have been doing this na.
sa heart center. So ibig sabihin, meron na tayong 17 out. Puro po ito DOH run hospitals.
Yeah, they are all regional hospitals of DOH, and this is in collaboration
So
with the
ang
Department of Health.
SPFC kompleto na, kaya
Yes.
yung isa sa mga nauna, no?
Yeah,
At saka Bicol, meron na rin.
Vicente Soto,
Vicente Soto, Cebu, Bicol Region 5,
Mariano
Iloilo
Marcos,
Region 6,
Six.
Mariano Marcos Region
Yeah.
1.
yeah.
So, tuloy-tuloy na po tayo. Meron lang po akong question. Bakit kadalasan pa rin sa kanila mas gusto nilang pumunta ng Maynila sa Philippine Heart Center or sa Southern kahit na meron na pong mga hospital sa Cebu na specialty hospital?
Okay, yeah. I think the answer to that is yung mga complicated, we still refer them to the Philippine Heart Center for kulang-kulang pang facilities.
So, ibig sabihin,
And
hindi pa rin ganun
may mga, yeah,
hindi pa rin ganun kakompleto yung pasilidad nila.
yeah, may kulang-kulang pa ng konti. Like for example, in very difficult cases, we need intra-aortic balloon counter pulsation machine. They don't have that. No ECMO machine, wala pa sila, mga ganyan.
Yun ang dapat nating makumpleto. Dahil habang nandiyan yung takot nila, apprehension nila na hindi kompleto ito, hindi pa rin sila pupunta doon sa regional hospital na yon. Kasi nandiyan yung takot, baka kulang to, baka ma-complicated. Punta na lang tayo ng Maynila pa rin dahil mas kompleto doon.
Pero at least ma-screen na sila. Yung simple cases that they can do, they can already assure and the patients can...
Kasi usually, yung takot nila, baka maging komplikasyon, maging complicated.
Yeah.
Alam mo naman, doktor, walang part 2 ang buhay. So, pag may nangyari,
Yes, I know. Yeah. Yeah, definitely. So, ito, the other one is alam mo naman, pag bago, people are always skeptical. I still remember sa Philippine Heart Center, many years ago, intern pa lang kami, Yung mga mayayaman sa atin, sinasabi nila, huwag ka na magpa-opera dyan. Sa States, nagpa-opera noon mga mayaman. Yung iba pumupunta sa Hong Kong at saka sa Taiwan. So, you really have to establish your credibility in your name. And it's not easy. It will take time. Kaya sinasabi namin sa mga regional centers, send us the doctors that are trainable, that are capable of passing the diplomate exam, because we would like to standard very similar to the Philippine Heart Center standard, which is a world-class standard. Ayaw namin na sa simula pa lang mag-isip na yung mga tao dyan na ay wag mo na lang paoperahan dyan, malamang yan, mamatayan dyan.
yun ang
Dahil na lang that is what we are afraid that will happen. Kaya we are very particular. Even ang candidates nila for training, we are screening them very well that they are the best that they can send us.
Tsaka yung cost po, no? Question, pag heart, parating pumapatak sa isip ng tao,
Mahal.
500,000 kaagad.
Yes. Million.
Million. Bakit po? Ano bang costing nito na sa specialista ba ito o yung mga gamit? Kasi pag heart talaga, unang pumapasok sila, it's not less than 500,000 kaagad.
Yeah. Let me give you an example. Let's say angioplasty lang. Hindi pa na-operahan yan, ha? Yung pinapasok lang yung balloon sa bara, tapos inflate yan para lumaki. No? So tapos, lagyan niya ng tungkod, which we call stent, para hindi kumipot ulit. No, that small stent is titanium, will cost 100,000 each. No?
Angioplasty po ito.
Angioplasty lang yan. Wala pang opera yan. So kung 3 ang kailangan ng pasyente, sa stent pa lang 300,000 na. No?
Mahal talaga yung
Yes, stent.
Stent na yun.
Yeah, imported kasi. No? So we don't manufacture them.
Wala kang mga source nun dito sa local.
Now, mayroon na China-made.
Baka hindi tatagal kung
Hindi naman. They are under license naman of the mother company in the US. Siyempre, may takot palagi pag yung iba nga, made in China, yan, mas mura. Wag na lang.
ano yung
Doon na lang sa mahal.
ano yung iba?
Most of them are made in the US. Of course, Japan makes them also in England and Germany.
Pero I mean, siguro naman at par naman or magaganda naman ang produkto naman siguro. Halos lahat. Hindi naman nila ibenta.
Halos, yeah. Oo, almost. Yung ano lang yan, China syndrome lang talaga siguro na pag made in China yan, But I think we have used them for quite a time and
So,
the results are good. Yeah. Oh,
How about the cost?
the cost is cheaper. Yeah, let's say like kung 100.
Ito, kahit saan gawa, US, Japan, China, importante, safe.
Yes.
Ma-prove natin.
Oh, yeah. They're very particular that they are FDA approved and they have been past the evaluation of our technical working group and our end users. So we will not compromise such a procedure para lang.
Kasi buhay po rito ang nakatayo.
Sabi mo nga, isa lang Walang part 2 sa buhay. Oo.
So siguraduhin talaga natin kahit saan gawa yan, importante ma-prove natin na if it's FDA approved.
Yes.
Yung safety po ng
You can be assured.
pasyente rito, importante po. Buhay po ang nakataya dito, sir. So yun po ang siguraduhin nyo lang po.
That is just one example. Now,
Yung angio plus yung
angioplasty
angioplasty.
yan.
What if merong bara?
Kung sobrang dami ang bara, may mga criteria kami yan. Hindi na siya good candidate for angioplasty. Bypass na yan. Now, let's say diffuse, long segment, marami. We have already shown studies kasi na mas advantageous ang bypass in long term. So, kung bypass, syempre, i-attach mo yan sa heart lung machine, tapos mag-critical care, stroke, matagal siya sa surgical intensive care, a team will handle, kaya it makes it more expensive. So kung buti na lang mayroon tayong benefit from the government, no? Like for example, ang bypass dito usually will cost you about 600 to 800,000. No? Pero kung higher ang level ng room, mas mahal. In private hospital, much more expensive. Ngayon, kung si benefit, bigyan ka ng gobyerno 500,000, 400 sagot ng gobyerno, 100 lang ang sagot ng pasyente. So mukhang doable, kaya nila maghanap. Pero
Ito
kung
yung bypass.
bypass na yan, pero kung wala talaga, admit namin sa service, no balance.
100 ang
Sa gobyerno, 100 ang sa pasyente.
So kaya maraming mga pasyente lumalapit dun sa malasakit center ninyo.
Yes, kaya ang haba ng pila.
So humingi ng tulong sa malasakit
Oo,
center.
tapos tawag lahat ng mga senador, lahat na candidate nila gusto unahin. Sometimes I tell them, Sen, tagal na ng pila ng iba dyan. Talagang uunahin namin.
Sisi yung pasyente dahil talagang nagmamadali.
Yes, lahat we do appreciate.
The essence po.
Kaya nga heart center is not capable of addressing the volume ng pasyente na nangangailangan.
Paintindi lang po natin sa mga pasyente, Doc Joel, lalo na yung sa angioplasty, na siguro kayo naman po sa heart center, tinitingnan nyo naman whether made in China, maganda naman po yung quality nila. Japan, maganda yung quality. US, and even us, Pilipinas, maganda na. Siguraduhin nyo lang po na
sana
quality,
we can manufacture them. So right now, yung sa pinakita ko, yung 8 na yon are capable of doing angioplasty, and we have already done bypass. We just did 6 bypass in Baguio. We did bypass already in Cebu, of course, many times na in southern Philippines. In Cotabato, we just did 2. In Mariano Marcos, we also did bypass na rin.
Tsaka, sa mga doctors rin, ng mga espesyalista, malaki ba yung charge ng pagpapa-opera sa heart?
Usually, mas malaki ng konti ang charge ng mga cardiovascular surgeons, maybe because of the risk involved, training.
What's ironic, Doc, no, merong isang espesyalista sa Davao. I think is an elected vice mayor na po ngayon, si Dr. Maruya.
Ayun,
Magaling. He's expert sa pag-opera.
Oo.
Sa heart.
But, sadly,
sa Davao. Tapos about two years or about a year ago, siya naman ang siya naman po ang
human as we are, kahit surgeon ka,
siya ang nagpa-bypass, no?
Oo.
Tapos what's ironic, siya ang humingi ng tulong rin sa gobyerno para sa assistant sa opera.
Yes. Marami na rin sa doktor sa amin na may bypass na rin at saka na angioplasty. Tingnan ang angioplasty, ang dali na. Gawin ka today, bukas pwede ka na mag-shopping sa Shumart.
Pag yun sinasabi ko nga sa kakaikot ko, kami ni Senator Robin, sabi ko pag masakit ang dibdib ninyo, parang dinadaganan ng hollow block. Sabi ko pa-check up na kayo, something is wrong with your heart. Check, wag nyo na tagalan, importante we can save lives.
Yeah, we are emphasizing that if they come to us early, ang ganda ng result.
Baka hindi maagapan pa, di ba?
Kung sira-sira na ang puso, talagang hirap na.
Pero si Senator Robin naman, pag sa kakaikot namin, tapos merong masakit yung dibdib ng yung babae na bata pa naman, nagbibigay siya ng advice.
Iba yun. Mga yakapsol yan at saka kispirin.
Din po ako eh. bibigay siya ng payo na take it easy, bata ka pa,
Oo.
huwag mong dibdibin.
So anyway, let me finish.
Okay.
Konti lang to, just 3 more slides. Next slide, please. Sunod na slide. Yun ang impact, no? Since we have started, yung 200 MDs na napadala coming from the provinces na na-train namin sa heart center. Mga 600 na nurses underwent critical care training. Tapos may 4 na hospital na accredited na ng PhilHealth Z-Benefit. Malaki yun. Kasi kung accredited, as I mentioned, 100 lang ang kanilang share, no? Pero kung hindi, sa'yo lahat yun. Sa bulsa mo lahat galing yun, no? So malaki din na ma-accredit na sila ng PhilHealth. But they have to do a certain number to be accredited. So nakahilera na rin, part na rin sa plano. Kaya kami ng surgical mission para yung nagawa namin doon, counted na yan sa procedure na ginawa doon. Sa kung 5 ang procedure, gumawa kami ng 5 doon, accredited na siya. So we are doing that. We are assisting them. Next slide. Next slide.
Mahal na tagapangulo, meron lang po akong tanong. Chairman, may tanong lang po ako.
Senator Robin.
Doc, ibig niyo pong sabihin, yung mga espesyalista po natin, kami na po yung pumupunta doon sa ospital.
Nag-surgical mission kami. Usually po, to start with ganon. And then,
Sa walong lugar na sinabi niyo, may CATMED na sila.
meron na rin silang mga surgeons.
Hindi na po kayo pumupunta doon.
Minsan we go there to enhance lang, to
Pero
support.
kaya na po.
Yung mga 5 dyan are, we can call independent. Pwede na.
Okay po. Salamat po.
On their own, they can stand on their own na.
Apo.
Next slide, please. Yun ang status nila ngayon, no? PhilHealth accredited. Ayan, 4. Yung yellow-green na yan, yung mga stand-alone. Ng red, independent, pwede na, sa dulo. Southern Philippines, Vicente Soto, the 2 leading one. No, of course, the others are almost nearing that status. No? Okay, initiated, Batangas, Paul Garcia doon sa Cabanatuan, Zamboanga Medical Center, Cotabato, pati sa Amay Pakpak has already purchased a high-end cath lab machine. Depende din kuminsan sa regional director na maagresibo. Talaga they facilitate having this machines early. And then next slide. Next slide, please. Just some photos already of the patients that we have done. We have done a lot of pediatric device procedure and surgery ng mga congenital defects. Okay, next slide. Ito lang ang suggestion namin, no? These are not really caveats. I think that is not the right term. It's called ideal setting sana ito, no? Na sana na-develop ang mga specialty centers, they will be organized as corporate entities to allow a certain degree of autonomy in their operation. But with a pay charity and bed capacity ratio of 30:70 in conformance with the Universal Healthcare Law. And also, secondly, sana the regional hospitals should have a separate and seen as a separate and distinct entities from other current specialty centers, that they will be but governed by the same set of board of trustees governing the specialty hospitals, no, Sara, to ensure na align ang trust at saka ang policies ng mga hospital na ito. Ayan ang amin. And then the last slide, please. As a corporation, Last slide, please. Itong caveat na we don't like to happen in new centers. Number one, sana talagang see to it that they are exempted from all kinds of revenues, including real property tax. Kasi earlier on, Philippine Heart Center was sued in auction. Can you believe that? No, by the QC LGU for non-payment of real property tax. I think you must have seen that in headlines years ago. So to ensure na yung bago, if ever ma-develop, no, they will be exempted from any kind of revenue taxes. Secondly also, that they should be exempt from the dividend law. Ibig sabihin yan, mag-remit ka ng 50% ng net earning mo to DBM. Now, we have to fight both of this hanggang umabot ng Supreme Court get the exemption. And I thank God, no, the Supreme Court saw the light and gave us the exemption. Kaya lang, minention ko yan, baka maulit na naman yan sa mga specialty centers na i-develop natin, no? And thirdly, exemption of the regional hospitals from the jurisdiction of the Governance Commission for Government, no, owned and controlled corporations, no, so that they are exempt from coverage of the GCG law, no, being research centers, so they are not restrained by the GCG law. So ito lang ang three na ano namin, the learnings that we had na will not have a repeat of this very agonizing problem. Thank you.
Salamat, Dr. Vanilla. May we now hear from Dr. Rosa Marie Rosete Liquete, NKTI, National Kidney and Transplant Institute, another specialty hospital na napakarami pong pumupunta, lumalapit. First question lang po, no? Before you start your presentation. Kayo yung nagkakandak ng nag-operate po yung mga kidney transplant sa NKTI?
Yes, Your Honor. Yeah, kidney transplant.
And then aside from NKTI here in Metro Manila, ano pa ho bang mga hospital sa buong Pilipinas na capable of conducting operation like kidney transplant?
Yes, Your Honor. Right now, we have 8 hospitals accredited as transplant hospitals, 8 government hospitals. But actually, we have like maybe 20 or more of private hospitals who are conducting kidney transplant, but only 8 government. And we are trying to capacitate around 8 or 9 other government hospitals so that all the regions will be covered. And I have a list of them if you would want later on.
Another question, no? Itong sa kidney transplant, di ba pag sino yung compatible na pasyente na magdo-donate, gano'n?
Sorry.
Individual, compatible na individual na willing to donate his or her kidney. Tama?
Yes, Your Honor, we have HLA tissue matching. Same blood type and then tissue matching, which is acceptable. And of course, the donor and the recipient, no, we cannot have a transplant without the donor. They should be fully worked up, each of them, so that transplant can be performed.
Etong another question is, yung mga, meron ho bang nagpapabili ng kanilang mga kidney?
Well, as you remember, we had before this problem, no, with buying and selling of kidneys. That was in the late 90s and then towards 2008, until this anti-organ trafficking law was pushed later on 2008 na na-stop na po itong kidney commercialism, no, especially with the foreigners coming in to the Philippines just to have a transplant. Now, occasionally we hear some cases of yun na nga, commercialism, but no foreigners for the moment. This has been curtailed. But you know, it's hard we have an ethics committee in every transplant hospital to make sure that this non-living, non-related donation, they are because of pure altruism and no selling, as much as possible, controlled by the
So dapat
ethics committee.
na ma-prove ng ethics committee na voluntary yung pag donate ng kidney.
Yes, Your Honor. For the non-related donation, voluntary, pure altruism. But, well, to say it bluntly, we cannot also control all of this, no? Minsan, nasa usapan na lang yan ng recipient and the donor.
Yung mga preso, may mga ganun ba?
Wala na po.
Wala na kasi paano sila makakalabas kung nakapreso sila, di ba?
Noon, yes, naririnig natin yan noong maybe 20 years ago. That is an arrangement with the Bureau of Prisons noon maybe, with the hospital, but wala na po yon.
Yung success rate naman po ng mga kidney transplant, kasi not all, I think, na naging successful, no?
Ang success can be measured like, say, sabihin mo, 1 year survival na hindi nagkakaroon ng rejection, no? Kasi in the long time, 5 years, 10 years, nagkakaroon talaga ng rejection, even if you have very good anti-rejection medicine. So ilagay natin na 100% naman in the first year, no? But you see, we have different types of recipients. Maraming comorbidities, may heart problem, may diabetes, may hypertension pa rin sila. So yan ang nagiging cause ng failure in the end. Not really failure of the kidney, but failure of the heart. So, naapektuhan na rin ang patient. But in general, it's 100% for the first year, no rejection.
Ito namang sa NKTI, ma'am. Sa inyo is yung about transplant, dialysis. Am I correct?
Yes, Your Honor.
So, maraming mga pribadong mga hospital na ngayon, they conduct dialysis, no? So, sa buong Pilipinas, even sa lahat, halos lahat ng region meron na.
Ang dialysis centers maybe more than 900 na, no? Both freestanding and also with sa mga hospitals din. But we need these dialysis centers because dialysis should only be a bridge towards transplantation. So we need these centers, and that is one requirement for a renal center, dialysis.
Meron akong narinig na may mga cases ng meron ba mga inborn na talaga na isa lang ang kidney, may mga ganon?
Meron pong ganyan. Sometimes a patient would know na isa lang pala ang kidney ko. I had a patient like that. Magdo-donate siya nung ma-work up siya.
Isa lang ang
Isa lang
nakita.
pala ang kidney niya. Ano na lang yon?
Is it a rare case yung isa lang o meron talaga?
It's very rare na isa lamang. Ang mas common is that dalawa man pero agenesis ang isa. Hindi nag-develop. Pero rare din naman yon.
Anyway, go ahead po, ma'am, with your presentation po.
Actually, when I received the bills, I studied each one and then summarized that these bills aim either to duplicate an NKTI version, no, in Cebu City nga ito, to establish a satellite or a branch, of the specialty centers. And then the third one is to create a renal specialty center as a unit or department within the DOH select hospitals. And I believe I am more geared on the number 3. Now, just to mention for some food for thought on the duplication of an NKTI version, this is by Senator Amy Marcos. She envisions an institute, Visayan Institute, similar to that of NKTI. We are corporate as mentioned, and this was formed in 1981. But NKTI became operational in 1983, so 2 to 3 years in the making yon. So with the Philippines as an archipelago made up of 7,000 islands and with the Gidas in the periphery, siguro if you want a specialty center, maybe at least in Luzon, Visayas, and Mindanao. But we have statistics to show that if ever NKTI shall remain the NCR specialty center, catering to a population similar to that of the population of the whole Taiwan, no? However, with the increasing population of CKD in Region 3, Region 4, A, and B, yan na ang marami ngayon. If you are from Pampanga, Region 4 and A, a similar institute may be justified in these regions in Luzon to serve also the neighboring provinces with the Gida areas, the Calabarzon, and the Mimaropa. With regards to the second one, establish a satellite. So as I was reading it, if ever, there should be a separate budget and not be taken from the specialty hospital. I have here some statistics to show na hindi naman namin kakayanin, no? Especially, MAIP namin, pera, the income comes from MAIP, 21%. From PhilHealth, 20%. Paano na lang ito yung aming pang QFS and discounts, which is na 29%. So all this, just looking at this, mukhang hindi pwede. Magba-branch out kami at hindi namin siguro kakayanin yan financially and also sa human resource. No? Okay. For the third, which is establishing specialty centers in the Department of Health hospitals with appropriate funding, of course. So I think this bill deals on realities that healthcare remains limited due to the unavailability of services, poor access, and unaffordability. This universal healthcare should be able to address. So I think it is more practical to establish a specialty center in select DOH hospitals. It will be cost efficient and experts and personnel are already there and accessible and can also be shared with other specialties. We have commonalities in terms of instruments with heart center, lung center.
So you mean, ma'am, your position with the heart center, lung center are the same position kayo na maglagay na lang ng centers like NKTI, lung center, Philippine Heart Center sa mga existing DOH hospitals.
Yes, Your Honor.
Kasi mas
practical and
you
can share expertise then and employees.
Mas mabilis.
Mas mabilis.
I would like to acknowledge the presence of the father of universal healthcare law, si Senator J.B. Ejercito, another advocate po ng health. Nagtutulungan po kami rito. Paano pa natin mapalakas ang ating healthcare system sa ating bansa. So, for the record, yun po ang posisyon ninyo, magdagdag na lang ng mga NKTI sa mga existing DOH hospitals para mas mabilis maglagay, cost efficient at practical.
Yes, Your Honor.
Opo.
So,
sa ngayon, ma'am, ilan na ho sa mga existing DOH hospitals like Philippine Heart Center na meron ho kayong capacity na katulad ng ginagawa ninyong proseso sa NKTI, yung pag-dialysis, and of course, itong pag-transplant. No? Yan ang pinaka-importante rin yan, aside from sa heart operation, yung heart transplant. Dahil napaka, ano yan, sensitive, delicate yan. Delikado yan. Expensive rin also, no? Kung sa heart nga, sabi ko kanina, 500,000 ang minimum. Pag bypass, 500,000. Ngayon, question, how about transplant? Minimum, magkano po ang nasa isip ng tao kagad, the cost?
Ang pinaka-minimum na lang ho natin, lalo na with the Z package, no? 600,000 and ire-ready. But, kailangan din i-work up muna ang recipient and donor. So, pag may Z package siya, 600,000 because 600 will be paid by the PhilHealth. Ang importante is that yung four pillars namin sa renal stratified framework that we have been working with the Department of Health. Kailangan meron kaming accredited facility and doctors, specialists. The transplant surgeon, the nephrologist, no? Mga dialysis po natin, urologist, sila po mag-oopera sa donor, at saka yung ating transplant anesthesiologist. But of course,
Aside from that, ma'am, no, siguro hindi niyo man aminin o I'm sure hindi pinapaalam sa inyo yung mga donor ng kidney transplant. I'm sure merong konsuelo yan o tinatawag. Kung hindi man nila aminin na bayad, so may konsuelo. And I'm sure hindi masasagot ng PhilHealth yung ibibigay mo doon. Tsaka pera na lang kung kamag-anak, anak, kapatid, o mag-donate. Pero kung ibang tao, I'm sure hingi talaga ng, mag-offer ka talaga ng any pakonsuelo doon na hindi masasagot ng gobyerno. That's the problem na kailangan magastos talaga. So, pag nagkaroon pa ng komplikasyon, gaya ng sinabi nyo, 600,000, aabot pa yan ng 1,000,000. So, pag heart, milyon ang pinag-usapan. Pag kidney, milyon ang pag-usapan. At hindi kayang bayaran ng mahirap yan, ma'am. So, ang atin dito is paano natin mapakalat sa buong bansa na yung capacity natin to operate, to transplant, to heart operation, kidney, salang, at paano natin mapalapit ang mga hospital? Paano natin mapalapit ang gobyerno sa tao? Yun po ang ating pagtutulungan po dito, ma'am. Lalo-lalo na po yung mga mahirap, na hirap talaga na magbayad sa mga hospital. Go ahead, ma'am.
yes, Your Honor, you mentioned about finances din naman. Kung kayo naman po ay service case, no? At may PhilHealth, NBB na po yun. Yeah? Yung operation mo, NBB. No balance billing. Yan, service case
Pero
po
ma'am,
tayo.
yung iba, aside from that, lumalapit rin po sa malasakit center, di ba? May mga, even yung mga billing nila sa inyo, merong malasakit center sa NKTI, meron din po sa Philippine Heart Center, sa Lung Center, saan pa ba? Sa PCMC rin po.
Okay.
Nilalapit nila kung in excess po dun sa covered by PhilHealth, malapit pa sila sa malasakit center. Talagang kulang. Gaya na sinasabi ko sa mga kababayan nating mahirap, lapitan nyo lang po yung malasakit center dahil para po yan sa mga poor and indigent patients ang malasakit center.
Yes, Your Honor, malaking bagay nga po sa NKTI ang Malasakit Center, no? At saka pumupunta rin sila sa PCSO, PAGCOR, DSWD. Ngayon, kasi hindi kasama sa PhilHealth, ito na nga ang inaano namin sa PhilHealth, natulungan kami sa work-up, pre-transplant work-up. Hindi covered ng PhilHealth yon. At saka yung post-transplant medicine, which is forever, hindi rin covered ng PhilHealth. And with the escalating cost ngayon ng pag-oopera, no? For example, ang PhilHealth, ang covered lamang ng PhilHealth is 600. Tapos copay niya 0 if sir. Kulang na ho sa 600 ngayon. Dumarating na kami sa 800,000. Tapos kung cadaver pa ang donor, right now meron kaming cadaver na makukuhanan ng kidneys, magagastos ang isang pasyente ng mga 1 million hospital pa lamang. Galing po sa brain dead patient. donor. Yung mga aksidente, oo. Brain dead.
Pwede pa yon. Parang gaano katagal pwedeng i-transplant pag
Okay. Kailangan ang golden period namin within 12 hours, no? Pero na-extend din ng 24 hours. Basta maganda lang ang preservation bago i-transplant sa pasyente.
so consent ng kamag-anak yun.
Yes. Consent po ng ng donor's family. Okay. So, paano natin maparating sa ibang region? Ngayon, ang mga regions na wala pa kami, no, nandito yung CAR, CAR is Baguio, accredited na, pero hindi pa sila nag-start. Region 1, 4A, 2, 3, 8, and 9, and BARM. Now, we have transplant surgeons na doon na we have help or included in our training. We encourage, in my paper nga sabi namin, gusto man natin na magkaroon doon sa mga centers o sa mga areas na yun. We encourage sana na homegrown ang mga trainees namin para babalik sila. What happens is that meron nga kaming na-train kunyari sa Batangas, no? Pero nandito pa rin sila sa NCR. So, kailangan namin trained surgeon, nephrology, urology, anesthesiologist para bumalik sila doon. So, yan ang problema. Some may want to stay in Manila because mas lucrative naman talaga ang practice, no, sa Manila. So, it's hard naman. But we have trainings already na makapacitate namin. Kunyari, isang GP, maging physician on duty sa mga dialysis centers. Kasi isa rin yon ang problema. Nephrologists should also be running dialysis centers. We have talked with other nephrologists, kunyari, sa Zamboanga City. Hindi naman sila makapunta sa malayo pala yung mga dipolog, ganon. Because ang traveling again for them, security reasons, problema lang. Nasa Tuguegarao, kunyari ang nephro mo, hindi naman makapunta sa yung mga neighboring pa doon na ibang towns, again for security reasons. So yan ay isang problema namin. Now, ang isa pa is that dapat aggressive din ang mga medical directors ng mga regional hospitals na to. I'll give an example. Siguro sa Zamboanga, no, I just learned na ang aking transplant surgeon doon nag-resign na because mahirap naman kasi ang support ng hospital. At marami pang demolition, marami pang infrastructure, ganyan-ganyan. So, okay, now, he will now practice in a private hospital. So, yan ang isang dilemma ng mga doctors namin whom we have trained at NKTI. So, in the resource stratified framework, which Yusek David mentioned, I think we are on the right track that we can capacitate the region, this BCC and ACC, to be renal care centers, and also not only in this BCC and ACC, but also down to your LGU and level 1, 2, and 3, and the barangay stations. So I believe these are the things which are very important for our renal care centers. Thank you, Your Honor.
Salamat. Senator JB, do you have any manifestation or question po?
Siguro may konti na tanong, hindi ko na naabutan, no, Mr. Chair, but going through the different bills that were filed, the establishment of a kidney, heart, lung center in all regions pa nga iba eh. And from what I gathered, talaga medyo mabigat yun, Mr. Chair, because it's not only the infrastructure, it's the personnel, the equipment, tapos yung kakulangan pa ng mga specialists, no, that are needed, no, to man these specialty centers. But at present, Mr. Chairman, during the time of PRRD, we have started through the Health Facilities Enhancement Program, establishing lung, kidney, heart centers, specialty centers in strategic areas, no? Like, for example, in Southern Philippines Medical Center, yung cancer center was already inaugurated by PRRD before he stepped down. From what I know, there's a lung, kidney, and heart center already, no, existing. That will service Southern Mindanao. Tapos sa Northern Mindanao naman, yung Northern Mindanao Medical Center, Cagayan de Oro. They were already able to perform open heart surgery, and soon nata, I think, with the coordination with NKTI, siguro soon, pagdatapos yung center nila, hopefully kidney transplant also. Tapos sa Central Visayas naman, to cater to Bohol and Cebu, it's in Bisoto. Tapos sa Western Visayas Medical Center, it's in for Western Visayas, that will service Panay and Negros. Hopefully Eastern Visayas na lang, Mr. Chair. Yun yung I think kulang na lang natin. Tapos sa Northern Luzon, no, Baguio General Hospital Medical Center. Ang ano ko lang, Mr. Chair, so sa mga nandito ngayon na heads ng mga specialty centers, so do you think it's impossible to really establish in every region, no? Medyo mabigat, no? That's 16 or 17 regions. So what do you suggest then? Ganun na lang, parang strategic areas that will cater to the different regions. Anybody can answer? Siguro si Ma'am Dr. Rose,
Yes, okay.
also, pwede isa-isa.
We just want to explain somehow what we have this resource stratified framework. Ito pong framework na to defines ano po yung mga service capability na specialty services that will be provided. So yung in terms of service capability from primary hanggang intermediate services hanggang specialty. Yun po yung tinatawag na resource stratified framework. For the specialty centers, meron po tayong tinatawag na National Specialty Center. Ito po yung kidney, NKTI, heart center, lung center. Pagbaba po natin, meron po tayong tinatawag na Advanced Comprehensive Centers. Ito naman pong capability nito, halos kapareho na rin po ng ng ating mga national specialty centers, except po mas advanced lang po sila in terms of training, research, and other special procedures as mentioned kanina po ni Dr. Joel na kaya pumupunta sa heart center. So, tapos po, per other regions, kasi ang catchment po nitong advanced specialty center are several regions already. Para pong subnational po ang function niya. Tapos meron po tayong tinatawag na basic comprehensive. Ito po yung nasa iba't ibang region. So makikita pa rin po natin yung services for the heart, lung, cancer, neonatal, as well po yung kidney at the different regions. Yun lang po. Medyo iba-iba lang po ang service capability since masyado pong very expensive for us to put up yung buong na center na comprehensive na halos pareho na po ng ating mga single specialty centers, national specialty centers. So, ang assurance po natin dito under our plan, Philippine Health Facility Development Plan for the development of the specialty centers, merong serbisyong maibibigay sa bawat rehiyon po.
At tulad po ng ma'am, Sir Chair, with your permission. So, ang target naman natin dito, of course, two birds with one stone, no? Unang-una, magastos din kasi from in the far-flung areas, other provinces, pupunta pa lahat dito sa Manila for the to be treated in the specialty centers. At the same time, overcrowded din, grabe rin ang pila, no? Sa Philippine Heart Center, sa NKTI, Lung Center. So, I think the rationale here, because that's why the centers filed, so that one, we will decongest the specialty centers in Metro Manila, and also more convenient, make it more convenient for people from the far-flung areas. So yung yung existing ngayon that's being done by DOH now, no? Yung sa Northern Mindanao, sa SPMC, Baguio General Hospital later on, and so on sa Bisoto. Yun po, you think that will be enough already to service the whole country, or may mga pwede pa tayong idagdag?
Actually po, in general, kami po kasi sa national office, but we can ask later po yung mga specialty po natin hospitals. Yeah, when we crafted po yung Philippine Health Facility Development Plan, we ensured yung services po nga po will be provided at the different regions given the resource stratified framework. So po ang question po is yung assurance nga po, pag fully operational na po mga ito, definitely it can be provided. Right now po, the Philippine Health Facility Development Plan, ang ano po namin dito, yes, we have identified the different facilities, centers, kung saan sila ilalagay, pero ito po naman is developmental. As we proceed, fully operational na po ito, we can add on later pa po, depende sa resources. Meaning po, ang parang gusto lang po namin express dito, our macro plan, which is the Philippine Health Facility Development Plan, we consider it as a living document na kung kailangan pa po at meron po siya magiging regular review or maybe every 3 to 5 years. Tapos based on sa need, if there is still a need, we can expand or add more centers po.
Thank you, Madam Chair. Mr. Chair, thank you, Director Vera. Kasi maganda naman talaga yung intention, no? But we have to face reality, Mr. Chair, that we have limited fiscal space, especially coming from the pandemic. Medyo hirap ang government revenues. So, but I'm very happy to note, no, because I go around a lot, no. I ride my bike, everything. Kaya I had the chance to go to visit yung Northern Mindanao Medical Center, Western Visayas, ongoing na po yung infra and SPMC. Tsaka nakakatuwa naman po, no? They were able to perform open heart surgery already, no? Di ba? Sa Northern Mindanao Medical Center with the help also of the specialists from Philippine Heart Center. So, sa ngayon po ang this will be enough, tingin niyo po, ma'am, that will be enough already siguro that given the limited fund budget that we have and fiscal space, maganda talaga kung lahat meron tayo specialty centers in all regions. So, ang tingin niyo yung strategic areas na lang, like for example, SPMC will cater to the whole of Southern Mindanao provinces. Yung Northern Mindanao, dito sa Cagayan de Oro, will cater to all the provinces in the north of Mindanao. Tapos, Bisoto, Central Visayas, Bohol and Cebu, Baguio General, hopefully for the Northern Luzon area. No? So, yung ganung setup, that will be more possible. Is it more feasible and possible to establish specialty centers? So, sige ba?
Senator, Honorable.
Manila.
Yeah. Yung building mo malapit na ma-start doon sa West Visayas. On a groundbreaking kami together before. Well, I think it's like a consensus that mas practical ang every region kaysa magsimula panibago sa isang lugar. At saka ito nasimulan na. And we thought before, this is suntok sa buwan eh. But now we are seeing doable siya. One at a time lang. Slowly. So it takes time to prime a regional hospital and prepare them. Ito, if I were share, I was a past, no, I am still alive. I am a past president of the Philippine Heart Association, and I had my meetings also with our counterparts in the ASEAN region, Malaysia, Thailand, Indonesia, and then we would meet yearly. And about 7 years ago pa ito, I was almost shocked to learn that Malaysia, which is a landmass with a population of 40 million, compared sa atin, archipelago, 110 million, Malaysia has about 100 cath labs scattered all over Malaysia. So, wow, huling-huli na tayo. No? That means, if you have a heart attack or chest pain at any part of the country, you can run to a nearby facility.
Sa atin po, ilan tayo sa Pilipinas?
When they had that, we had about 11. Noon yun, no? But now, marami na. I showed,
How many?
I showed a while ago that in about 8 regions now already equipped. Even Cotabato has a cath lab, Amay Pakpak, you know,
Yeah, because
soon.
Marawi was, Mr. Chair, na tayo naglagay ng ano nun, during time of PRRD.
Yeah.
For after the Marawi siege, we may put in about 300 million for the improvement of the Maypakpak Medical Center.
Strategic din sila eh. Ang daming around, sila yung puntahan. So, in some areas, it may take some time. Pero we look at it as doable.
Well, at least we it's good to hear from you from those in authority, Mr. Chair, no, that is yung practicality. Maganda talaga pakinggan yung every region, but I think mas practical nga itong existing. I think even DOH in its identification naman through the HFEP improvement of the putting up the specialty centers, may study rin naman kayo eh. And you know which centers are capable, di ba? Kung sino yung full equipped, kaya nga SPMC, Northern Mindanao, Bisoto, BGH. Ang kulang na lang siguro kasi Baguio General, I think kailangan maglagay tayo sa Ilocania, medyo malayo, and also yung eastern side, it will be very far naman to go to Baguio, yung sa Cagayan, Isabela. With the SIMC, bago naman tayo dyan, Southern Isabela Medical Center, bago rin yun. I think you can look into that and establish. So probably you can look at the incidents na lang, probably nung high renal problems, high cardiovascular. So palagay ko gano'n naman ang ano ng DOH eh. No? So ang suggestion po ninyo, Sir Chair, siguro yung mga existing specialty centers that are ongoing, probably tapusin na lang muna natin, ano? Before we think of branching out to others. Tapos marami naman dito, may mga heart centers na rin pala. Batangas Medical Center, may Pakpak, Zamboanga, no, that are ongoing. So, that's all, Mr. Chair. I just wanted to hear also from there. Alam ko, it's really difficult to establish a full NKTI, medyo mabigat talaga. But I think yung existing that we started actually, Mr. Chair, noong time ni PRRD nagsimula yun eh, yung establishment ng mga specialty centers in the different strategic hospitals around the country. Si ano yata, Mr. Chair? Si Miss Kalimag wants to be recognized.
Hello, Mr. Chair.
Ma'am Maria Minerva Kalimag. Ma'am, good afternoon po. You're from Philippine Medical Association.
Yes po, President of the Philippine Medical Association. Honorable chairs and honorable senators, I would like to just tell everyone that we are comprised of 91,030 physicians all over the country. We actually are the health human resource for the whole nation. We are comprised of 119 component societies in the 17 regions, specialty divisions, 75 specialty and subspecialty societies, and 45 affiliate societies. We recognize po the models pointed out by Drs. Balanan, Dr. Abanilla, and Dr. Liquiete. And we know that tama po yung sinasabi nila, no? Na baka may infrastructure pero kailangan po siguro yung capacity building, and so that the centers here in Manila can build the capacities for the areas in the different provinces. Alam niyo po, minsan, for example, Dr. Inlanao del Norte asked me, ano po kasi ako, nasa program accreditation po din ako ng anesthesiology. And we accredited may Pakpak Department of Anesthesiology already. Ang ano po namin doon is, sabi niya, magpadala ka naman doktora ng anesthesiologist dito sa Lanao del Norte. But of course, we say na alam natin na yung health, yung safety din doon, no, is a problem. So tama po din yung sabi ni Dr. Liquete na padala sila, no, kasi devolved po tayo eh. So the LGUs should be able to uh, give the items, for example, and then they can be trained in Manila, so they go back to the provinces where the LGUs came from. Another problem po kasi, I go around the country, and hindi po kasi madaling sabihin na Northern Mindanao, for example. If I have a heart patient, for example, in Bukidnon, it's 2 hours away from Cagayan de Oro. The Laguindingan Airport itself is about an hour away from Northern Mindanao. The whole of Southern Mindanao, for example, Davao, if we're coming from the South Cotabato, for example, it is 6 hours away. So, ang point po natin, let's make things accessible. Kung magkakaroon po tayo din ng network of transportation, ambulances, for example, that can, transport. Kasi ngayon, di ba po, sabi natin, mga government regions, in the regions muna. So tama po yan, sa umpisa, ganyan, no? Pero siguro yun nga, yung accessibility po kasi kagaya kunyari sa Baguio, kahit sabihin natin na nasa Baguio, if I am coming from Ilocos Sur, for example, even if I pass via Cervantes po, it will be so many hours, maybe 3 or 4 hours before I can go to Baguio. So, yun po eh. Kailangan po tayo, for example, a patient from Camiguin, magta-travel pa po siya ng Roro, kunyari, 1 hour to Hingoog Medina, and Hingoog Medina is another 2 hours to Northern Mindanao, Cagayan de Oro. Yun po kasi ang kakaiba sa ating land, sa terrain natin, no? Yung pulo-pulo po tayo, separated by sea, tapos yun pong land natin, bulubundukin naman po. So, siguro, honorable senators, isa po siguro yun, handa pong makipagtulungan ang Philippine Medical Association. With regards to, yun po, tutulong kami sa mga specialty centers, heart center, kidney, lung, at saka po, yun, mga specialty centers po, para siguro manghikayat kami coming from the provinces para mag-train po sila and build capacities for our regional centers. Maraming salamat po.
Maraming salamat. Ma'am, isa pang hinihingi rin naming tulong, lalong-lalo na po sa mga surgeon, yung mga espesyalista natin. Paano ho natin matulungan? I'm not saying na libre, no? But paano natin yung mga charity, lalo-lalo na po sa mga mahirap, dahil halos lahat naman po itong government hospitals natin, ang lumalapit naman po ay mga mahihirap naman po, hindi naman po mayayaman ang lumalapit dito. Yun lang sana, paano natin matulungan itong mga pasyenteng mahirap. Bawiin nyo na lang doon sa mga mayayaman yung charges
Alam ko
po.
din po yan. Honorable Chair, kasi I also work with the East Avenue Medical Center kung saan pila-pila ang mga pasyente. Halos wala na nga pong mahigaan, no? Kailangan maghihintay tayo ng Pero unti-unti na pong lumuluwag. With regards to yun naman pong nandito rin po yung president ng PCS, for example. Talaga pong minsan isang linggo kaming walang trabaho dahil po pupunta kami sa mga probinsya para po mag-medical missions.
Opo.
Yan po, may assure ko yan sa inyo. Kasi talaga pong kahit kami, siyempre hindi naman po makaka-opera yung sirkulano kung wala po yung mga anesthesiologists. We know our responsibilities to our kababayans din po. Kaya nga po ang aming team for this year in aid of universal healthcare is nagkakaisang PMA para sa kalusugan ng sambayanan. Translated po 1 PMA for a Healthy Pilipinas. So, siguro po, makikitulong po kami. Gusto po namin yan, no? We are also focusing on minority health this year para po naman yung ating 110 indigenous people at saka yung ay matulungan din natin in all areas of our country. Recognize lang po natin yung accessibility issues para po talagang maganda po yung maging outcomes ng mga pasyente natin. Maraming salamat po.
Salamat po, ma'am, aside from sa pandemic, no? Maraming salamat sa inyong sakripisyo, sa mga doctors, sa inyo, sa Philippine Medical Association, sa lahat ng health workers, mga frontliners. Maraming salamat po sa inyong sakripisyo. Iba sa inyo, nagbuwis po ng buhay. Hindi po natin mararating ito kung hindi po sa tulong ninyo. So patuloy lang po nating tulungan. Alam ko marami po akong kilala sa inyo na talagang nag-opera ng libre, mga pinakamagagaling na espesyalista sa PGH at ibang parte ng bansa willing to help the government and willing to help the poor people. Magkasama po tayo diyan, ma'am, sa pagtulong sa mga mahirap. Maraming salamat po, Dr. Maria Minerva Kalimag, Presidente po ng Philippine Medical Association. So ma'am, Dr. Liquete, tapos na po tayo. If we're finished, proceed muna tayo sa Philippine Cancer, Philippine Cancer and after. Philippine Children's Medical Center, Dr. Sonia B. Gonzalez or Emmanuel Garcia, Mr. Anthony Emmanuel Garcia, and Ma'am Julie Marie Lafortesa. Go ahead, Sir Anthony.
Good afternoon, Honorable Chairman Senator Bongo and Senator J.V. Ejercito. I am here to read the position paper of the Philippine Children's Medical Center. Also, good afternoon, Senator Tulfo. The Philippine Children's Medical Center fully supports the Act, as this will not only provide availability and accessibility to specialized pediatric healthcare services in the identified region, but also address the responsiveness of the healthcare system to alleviate the plight of children and their families of additional cost and burden of traveling given the unavailability of such specialized healthcare services in the respective region. Now, PCMC has already established its clinical departments which cater to almost all pediatric subspecialties. Currently, there are only 2 hospitals in Metro Manila providing purely pediatric healthcare services. PCMC also receives referrals from all regions of the country. In line with the universal health care, the proposed bill will augment the services as apex hospitals so that patients needing specialized pediatric care need not to be transported to Manila. Now, the PCMC would like to emphasize that the following areas be also considered in the envisioned legislation. Number 1, the creation of a technical working group of PCMC to study and assess the feasibility of the proposed regional satellite facility. We also recommend that PCMC shall capacitate existing regional hospitals through training and skills development and strengthen its healthcare delivery network. Number 3, amend the charter. Should PCMC take the lead in planning and development of PCMC satellite branches in other regions for a clearer mandate? And the governance structure and operations of the satellite hospital shall be under the management of the Department of Health, Board of Trustees, and supervised through the leadership of PCMC. Rest assured that the same quality of specialized pediatric care and manpower services being provided by the main PCMC will be duplicated in its satellite branch. Respectfully submitted, Your Honor, Mr. Chair.
Salamat. Sisingit ko na rin po kasi itong Dr. Liquete at sa ating heart center, merong bagong OFW hospital tayo. Ito, mahal namin ni Senator Raffy and Senator JB ang mga OFW. Na posible bang maglagay rin po ng mga specialty center doon sa bagong OFW hospital? Nandun po ito sa Pampanga. Para hindi na sila kailangan pang lumabas. Halimbawa, yung mga kailangan magpa-dialysis o yung mga heart cases and lung cases and even children cases. Pwedeng pag-aralan rin natin na malagyan rin po ng mga specialty center doon sa loob ng OFW hospital. Nakakatapos lang din po dyan sa Pampanga. Nandito ba yung mga tiga Philippine Cancer Center? Ma'am? Dr. Melissa Sena. Good afternoon po.
Good afternoon, Senators. Good afternoon, Senator Bongo. So the Philippine Cancer Center is envisioned to be the National Specialty Center for Cancer. But at present, it is still under development. It is established by virtue of RA 11215 or the National Integrated Cancer Control Act in 2019. So besides providing highly specialized hospital care for cancer, the PCC shall provide a venue for research and for training of health workers. It shall also be the national repository for cancer registries to guide policy making and planning. So the development and functionality of the hospital, of the PCC, shall be in phases, considering the availability also of human resources for health. If funding is continuously available, the infrastructure is projected to be completed by 2027 and the hospital shall be fully functional. At present, the DOH has 11 advanced comprehensive centers for cancer. So these are the centers with catchment at the subnational level. And then we also have 13 basic comprehensive centers for cancer which cater to the population at the regional level. A total of 9 specialty centers for cancer in DOH hospitals are functional as of today. So we support the establishment of specialty centers across the country to increase access to specialized care, but we propose that it be established in existing DOH hospitals. The establishment of single or multi-specialty standalone hospitals may be considered in the long term, but meantime, we advocate for upgrading of DOH hospitals to increase their multi-specialty or specialty capability.
Question, ma'am. Itong sa Davao, di ba may cancer center din kayo doon? So, under po sa inyo yun?
Sa DOH po, because PCC is also part of the DOH family.
Okay.
So yung nasa Davao po na Southern Philippines Medical Center is the Advanced Comprehensive Center po, which caters to subnational level sa Mindanao.
Ilan pa yung mga katulad ng cancer center ng Davao across the country po?
So for Advanced Comprehensive Center po, yung ka-level ng Davao, 11 po.
Saan po ito?
6 in NCR. So, dalawa po sa Luzon.
Pwede yung pangalanan saan sa NCR?
Yes po, sir. So, for NCR, the Lung Center of the Philippines, of course, specific for lung cancers. The Philippine Children's Medical Center for Pediatric Cancer. National Kidney and Transplant Institute. The Philippine Orthopedic Center. Jose Reyes Memorial Medical Center. And the East Avenue Medical Center. For Luzon, we have the Baguio General Hospital and Medical Center and the Bicol Medical Center. So to cater to the Northern Luzon and the South Luzon area. For Visayas, we have the Vicente Soto Memorial Medical Center and the Western Visayas Medical Center. And for Mindanao, sir, we have the Southern Philippines Medical Center. These are our advanced comprehensive centers.
Ano pong diferensya ng in the administrative operations of a hospital under the DOH and a GOCC hospital like Lung Center, Philippine Heart Center, Philippine Cancer Center, and KTI? Kayo po ay GOCC, di ba? Anong pinagkaiba po? At what are the sources of income of a GOCC hospital as compared to a DOH hospital?
Sir, the Philippine Cancer Center is not a GOCC hospital.
Hindi.
By virtue of RA 11215, it is part of the DOH family. So, budget hospital po siya. We don't have a corporate structure.
Lung Center po, Heart Center, NKTI, and itong apat ang under GOCC, no?
Yes, sir.
Segue muna tayo. Ano bang pinagkaiba po sa administrative operations itong dalawang?
For lung center, Your Honor, yung 75% of our operating budget comes from corporate income and 25% from subsidy or support from the national government, as compared to 100% subsidized for the DOH hospitals.
Go ahead. May tatanong rin po go ahead, Senator Rafi. Iba. Mamaya. Anyway, ito pong going back to cancer, no? Unlike heart, merong operasyon lang na opera. NKTI, meron tayong transplant, children's. Itong cancer talaga until ngayon, wala pa talagang cure or gamot, no? So, yung iba talaga, bakit mas gusto nilang pumunta sa ibang bansa para mag-treat doon? Mas advanced ba yung kanilang treatment doon kumpara sa ating ginagawa dito? O mas nakahaba ba ang buhay nila kung doon yung treatment?
Sir, wala naman pong study na nagsasabi na mas maganda ang survival rate pag na gamot abroad. We believe na yung ating mga hospitals in the Philippines, not just the DOH hospitals, but also the private hospitals that are licensed as cancer treatment facilities have the capability. Ikot ko lang po yung sinabi kanina ni Dr. Abanilla na you have to build the trust of your catchment population. Meron po kasi tayong notion, mga Pilipino may notion na mas magaling at mas advanced sa abroad. But we believe na yung ating mga cancer centers have the capability to treat our patients, sir. Thank you.
So sa ngayon po, across the country, marami na tayong mga cancer center at marami naman tayong espesyalista na mula sa mga private doctors na willing to help, no? Gaya kaninang Philippine Medical Association. Ako po ay nagpapasalamat sa inyong lahat. At sa mga kababayan natin, yun talaga ang nakikita ko, yung mga malalayong lugar, mahirap. Minsan hindi na nga nadidiscover na cancer na yung sakit. Hindi na po nagagamot. So pagtulungan po natin ito to establish more specialty centers na I agree with you. Yun po yung position ninyo, no? Ang atin dito is paano mapabilis to establish specialty centers in existing DOH hospitals or facilities across the country. Paano natin mapakalat? Just like the presentation of Philippine Heart Center kanina, marami na pala silang mga hospital na nalagyan na. No, ang iba almost finished. There's iba naman they're starting to put facilities para sa specialty center.
Mr. Chair,
Go ahead, Senator.
Pagitin lang yung cancer. During the last hearing that I attended, it was mentioned here those billions worth of medicines na sayang at supposed to be dapat na ibigay yun, nabulok lang sa mga bodega ng DOH. And some of those medicines are para po sa treatment of cancer, para po sa mga pasyente na nagki-chemotherapy para ma-address yung pain from as a result of chemotherapy. I mean, the side effects. So, anong nangyari po dun sa mga gamot na yun? So, dapat po mapunta sa inyo, di ba? Nasayang lang. Na, meron bang na mga napunta sa inyo dun sa mga nasayang na gamot na yun?
Sa ngayon, sir, wala pa po because hindi pa po functioning as a hospital ang Philippine Cancer Center. Meron po mga medicine access sites for cancer. Ito po ay nasa iba't ibang hospitals across the country. At doon po dinedeliver ng DOH Cancer Control Program yung mga cancer medicines.
So, Kaya nga po, dinideliver doon and
Don't have this, Sir. Sir Rafi, kasi ako po ang author ng National Integrated Cancer Control Act.
Okay.
It was just implemented last year, kaya bago pa lang yung ano.
sige.
Just for your information po.
Okay, thank you. Hindi, kasi napanggitan lang cancer, so bago lang sila. Okay. Yes, all right. Hindi, kasi hindi pa na-address talaga yung total issue na yun. At kung nandito pa yung mga taga-DOH, I'm still waiting for the records to show na talagang yung mga medisina na nag-expire ay napalitan, because I was promised na I will be provided, the chairman of that committee will be provided of data and records showing na napalitan or na-refund yung ating gobyerno tungkol sa mga nabulok na medisina. At the same time, yung mga naging pabaya ay nakasuhan at bibigyan tayo ng listahan ng mga naging pabaya. So I'm still waiting for that, and hopefully we will provide it. Kasi po, kailangan talaga malaman ng taong bayan na seryoso po tayo sa ating mga trabaho rito. Kapag meron tayong kinakasuhan dahil sa kapabayaan sa ating gobyerno, sa kanilang tungkulin sa ating gobyerno, seryoso po tayo na mga prosecute sila. Kasi kung hanggang press release lang po tayo na merong kinasuhan and then later on, malaman-laman natin na baliwala din yung kaso kasi hindi tayo umaaten o hindi natin tinuluyan, parang niloloko lang natin yung mga sarili natin dito. Now, going to my question, Mr. Chair, yung pong sa pagkukonstruct ng specialty centers, like I said, pabor po ako doon. Ang tanong ko lang, saan po magagaling ang pondo nito? Especially now, I've attended several hearings already at nakita ko left and right ang pag-slash ng DBM ng mga budget. In fact, tulad yung sa Department of Migrant Workers, dahil bago lang yon, yung po ang binigyan na dahilan ng DBM na kaya sila nag-slash left to right, maging yung sa OWA, yung capex ng OWA, ay dahil bago lang daw. So, paano nyo po masusustain itong mga centers na ito kung later on, basta na lang kayong i-slash ng budget ng DBM? Go ahead po, ma'am.
Yeah. Actually, for the 2023 budget, it's part of our appeal that to consider the funding for the specialty centers. Sana po mag-grant yun. Umaasa po kami sa tulong nyo na mapagbigyan po yung hinihingi po naming additional na 2.3 billion for the specialty centers. We recognize po, DOH recognizes po the limited fiscal space of the government as well as the cost of establishing these specialty centers. Kaya naman po kami, at for kada may opportunity, we go to development partners, submit ng proposals for the different specialty centers na para ho makasakaling mapondohan. At kung meron pong may mga savings na nakikita po kami, we submit proposals din po.
Advice lang po, ma'am. Kasi base po sa aking pakikipag-usap sa DBM, ang sinasabi nilang reason kung bakit na-slash yung budget na ni-request ng anumang agency ay kakulangan daw po sa mga dokumento, at kapag sila daw po ay dala ng notice na ini-slash ng budget yung departamento niyon, hindi raw sumasagot. So, dapat, pag nag-submit po kayo ng, see, thank you. O yan. Ibig sabihin, talaga itong DBM may problema. Kapag kayo po yung nag-submit ng request for budget, dapat po ma-justify nyo talaga lahat ng klaseng mga dokumentong kailangan, feasibility studies and all, nandiyan po talaga. Kasi yan pong ginagamit palagi ng rason ng DBM, na kulang po sa dokumento. And nung binalik namin sa kanila yung kanilang proposal na budget at with request na to submit additional documents, hindi na kami binalikan. So sana po maging masigasig kayo, especially sa specialty centers. Naboto naman po ako na kapag nag-submit po kayo, kahon na kahon talaga. Kumbaga nandyan na lahat. And then bantayan nyo agad. Panayang tawag nyo sa DBM, o DBM, may problema ba? Sabihin nyo agad sa amin para may-ready namin yung mga papeles. Yun po yung ibig sabihin. Okay? Dalawa na po. Isa na lamang po, Mr. Chair. So yung una, yung papeles tungkol po dun sa mga nakasuhan ba, kung nakasuhan na talaga, yung mga nagpabaya sa medisina, you will submit that to us, right? I, for one, is very interested talaga. Gusto ko talaga malaman. Kailangan talaga makasuhan dito, yung naging pabaya sa mga medisina. Number 3, magkano pong sweldo ng mga nurses natin sa mga government hospitals?
Salary grade 15 and around 30, 30.
34 to 36,000.
Mas maliit ang sweldo ng nurses sa private, no? Kaya mas na-encourage sila pumasok sa gobyerno. Sa gobyerno, sir, mas mataas.
May ibang nagtsatsaga sa private kahit na maliit.
Oo.
And then yung iba gusto sa gobyerno dahil mas mataas.
Mas mataas, and even sa police nga ngayon, mas mataas pa yung sweldo ng nurses na sa police kaysa sa privado.
Kasi ito nga, Mr. Chair, lang yung ating mga nurses. Kung napapansin nyo, nagkakaroon ng migration papunta ng iba't ibang bansa dahil mas mataas ang sweldo. Marami sa mga taga-gobyerno nating nurse na naninilbihan or nasa nasa mga government hospitals, sila yung madaling ma-recruit papuntang abroad. So ano pong ginagawa ng ating pamahalaan, ng ating PGH para ma-address itong issue na ito, yung mass migration ng mga nurses, if you will. Sa ngayon, ang ideally dapat is 1:4, one nurse to 4 patients. Well, ngayon parang 1 nurse to 20 patients. So, ano pong ginagawa? Ano po yung plano natin para naman mapigilan kahit papaano itong pag-alisa ng mga nurses natin dahil para sa kanila, ang liit lang ng sweldo kumpara sa ibang bansa.
If I may say something to that is a real problem. No? Ang kalaban natin, hindi yung private hospitals here, but the hospitals abroad, which pay 3 times more than what we pay. If we give 34 to 36,000, I think they can earn from 90 to 120,000. So, given the choice, definitely they'll grab that. No? It's becoming really a headache for us, and we have to close some of our wards because to keep the safety ratio. Tama ka. When the ratio gets to be stretched apart, that will compromise nursing care. So what are we doing? Many things. Lahat na lang na acrobatics ata, no? We got in touch with all the nursing schools and tell them that we are needing. We posted on social media. We even thought of utilizing the underboard as assist, but then we are also afraid of that because they are not licensed yet, and that will remove their time to study as well. So, and then different incentives also, overtime in another ward kung kaya nila, no? And I think DOH is having some dialogue also and negotiations with CHED and DepEd as to
Sorry, sir, if I may interrupt. How about yung mag-offer po kayo ng full scholarship program sa mga nurses sa mga iba't ibang eskwelahan, mga probinsya, full scholarship po.
Yeah.
And then nandun yung kondisyones na kapag ikaw na-graduate, you must serve at least 4 to 5 years
yeah.
bilang nurse dito sa ating bansa. After ma-serve mo yung 5 years, it's up to you kung gusto mo pumunta ng mag-abroad. Pero for the meantime, dapat magsilbi ka muna ng 5 taon dito. And then if you keep doing that cycle, at least mami-maintain natin ang maraming nurses sa ating hospital.
That was actually floated during the Congress hearing. One of the congresswomen proposed, why should we not impose some ban sa mga lumalabas and use that money as scholarship in support to the nursing program?
Why not? Do we need legislation for that?
Yes.
If you need legislation for that, I, for one, will support that as a legislation pertaining to that para kung ito'y makatulong yung mass exodus, if you will, ng ating mga nurses papuntang abroad, then I will. And I suppose a committee chair sa health would support also legislation tungkol dun sa pinag-usapan namin ngayon, Mr. Chair, yung bang full scholarship program sa mga nurses natin dito sa Pilipinas, and then magkakaroon ng ban na at least for the next 5 years pagka-graduate mo, pag nakuha mo yung lisensya mo, hindi ka muna pwedeng lumabas. After that 5 years na nag-expire, so pwede ka na pumunta ng abroad kung gusto mo. And then yung susunod na batch, yun ang sasalo doon. That way, mamimaintain natin yung number of nurses required.
Pag-aralan natin, Senator Tulfo. Kung ano pong
Your
mas
Honor, this other hypothesis, no, why we have lack of nurses. Well, we had a pandemic, and we have the exodus and the need from other countries, and then sabay din ang effect daw ng change in curriculum ng K-12 na nagdagdag ng 2 years. So may 2 years na halos walang graduate ng nursing, nagtapat doon sa year
Sa
after the
K-12.
pandemic. Yes.
Okay.
That's another hypothesis that was.
Okay, that is also possible,
Yeah.
yung sa K-12.
So anyway, kung matapos na yan, kasi we always have excess nursing graduates before.
Ngayon, because of the pandemic,
Ayun
K-12
lang.
nawala. Okay. So, yun nga po, isa pa siguro dyan, incentives and benefits. Sorry sir, nung sa last hearing, nabanggit ko nga ito, yung mga nurses natin na nagtaya ng kanilang buhay during the pandemic, yung kanilang overtime pay, yung kanilang hazard pay, hindi maibigay-bigay. Yung kanilang ilanin sa mga taga-orthopedic na recently lang nag-strike dahil maliit na nga lang yung in-expect nilang hazard pay, pinagkait pa sa kanila. So siguro next time, dapat we should be sensitive doon sa mga needs nating mga nurses. Kasi nga po, nagsisialisa na nga sila, tapos ngayon, ipitin pa natin yung kanilang mga benepisyo, ano na yun, di lalong maraming mga magsisialisan. Mainggan yung umalis dahil nagpapakabayani ka na nga dyan sa Pilipinas. Ang liit na nga ng sweldo, hirap ng trabaho. Pagkatapos, konting benefits lang, bonus and overtime, pinagkakait pa. So, is that being addressed right now?
In fact, sa nagde-demo dyan, mga alliance workers namin yan, NKTI, Lung Center, PCMC, they held already a rally in front of NKTI and Heart Center. But thank God, only a few days ago, na-download na yung memo. They are releasing an allotment. We will receive the 5 months HEA or one COVID care. So from February to June.
Anong taon po ito? Ito yung sa 2021?
No, 2022 lang to.
About the 2020?
Yung retroactive na 2021, wala pa.
Wala pa. Yun ang dapat hanapan ng pondo ng executive ng DBM, no? Kasi 2021 pa yon at services rendered na yon.
Yeah.
At nung previous Congress nga, hindi tayo pumayag doon sa proposal na yung bibigyan ng incentives o allowance, yun lang na-expose, kikwentahin yung araw. Sabi ko, pag pumasok ka sa hospital, expose ka na.
Yes.
So dapat at risk na lahat. Maliit na amount lang ito sa serbisyo at sakripisyo na binibigay ng ating mga kababayan. Isisingit ko lang po, Senator Tulfo, na mention mo about nurses kanina. Meron tayong doktor para sa bayan, di ba? Na parang obligado silang, scholar sila, at obligado silang mag-serve muna sa atin dahil naging scholar sila. Baka pwede rin ito gawin sa mga nurses natin. Scholar sila at
That's precisely what I'm saying.
maganda yun.
Na scholarship program, full scholarship program, and then after na makapag-graduate sila.
Gawin natin nurses para sa bayan.
Exactly. Binigyan mo lang ng pangalan, pero yun talagang idea. Yun yung sinasabi ko.
Salamat.
Sabi niya, it needs legislation. Kaya nga, I was telling you na kung pwede, gumawa tayo ng supportan mo, magpapasa ako ng bill.
Pwede po, mag-co-author ako sa iyo.
Exactly. So, okay sa'yo yun.
Okay yun.
Okay, sabi mo kanina, pag-aaralan ko.
Hindi.
So, okay na sa'yo. Okay na.
Basta
Pag-aaralan natin dalawa kung paano.
pag-aralan natin, unahin muna nila yung pagsiservisyo dito sa ating mga kababayan dahil may backlog talaga tayo ng mga nurses. Kulang talaga. May mga hospital tayo pero kulang yung mga nurses. Even ilang pasyente nga yung ratio, no?
Yeah, 1:4 ang ideal talaga. Pero naging 1:20,000.
Pero importante, maingganyo natin ang mga nurses
Magstay.
na magstay at bigyan ng sapat na compensation yung kanilang pagsiservisyo dito na hindi masyadong malayo sa ibang bansa.
Yung bang ibig sabihin namin ni Senator Bongo, yung alagaan natin sila, tatratuhin natin sila na maayos. Kasi the way it is, tulad ng sinabi, yung mga exposed lang. Ewan ko kung sino yung nagsabi ng gano'n, sino nag-invento na babayaran lamang yung mismong na-expose lang during COVID sa COVID ward. Yung pagpunta mo pa nga lang doon sa ospital, expose ka na agad. Kaya nga kung sino man yung may sabi noon, mukhang hindi ata nag-iisip. Mukhang kailangan natin bumalik sa kindergarten. Hindi, totoo nga naman. Di ba, paglabas mo pa lang ng bahay, nandun yung possibility, ma-expose ka sa COVID, magkakasakit ka. Yung binibigyan na dahilan na bibigyan na ng hazard pay, pag ikaw pumasok sa ward ng COVID. Pero kung nag-duty ka lang sa ospital, nalabas-masok yung mga may COVID, hindi ka babayaran. Yun ibig sabihin, dapat we should be fair and sometimes we should use our common sense. Importante talaga din kuminsan common sense. Ano po? Kaya nagkakaroon ng problema sa ating bayan, nagkakabulbul, nagkakagawang-gawang takbo ng ating pamahalaan ay sapagkat there are some people unfortunately in our government who doesn't know how to use common sense. Yun lang po yung sa akin. And very last na po, nabalitaan ko po yung tungkol sa heart center na kinukonstruct at napahinto. Anong nangyari doon? Yung ho ba ang pinaka-latest pa rin ho ba yun o naayos na po yung problema yun?
Wala kami so far project na napahinto, no? It just took time for it to be approved kasi yung latest namin na malaking project, yung Mayowa, for the 12-story building extension.
Yung release ng funding ata. Nagpapasite ka ng hospital. And then, hindi ata nirelease yung funding. Ba't iniipit? Sino nag-iipit ng funding nyo para doon sa heart center?
Pending completion of documentations. Daming required kasi, no? One that was delayed was the approval of the Board of Trustees. Now, during the pandemic, walang board meeting.
Okay.
So, yeah.
Yun lang po. Aking last word is, I'll be very, very supportive. 101% supportive ako sa mga budget requests ng DOH kasi alam ko very important po yung kalusugan para sa ating mamayan at ang recipient po ng mga government hospitals are the poor people. Kasi yung mga mayaman po, can afford naman sila sa mga private, pinakamahal na private hospitals. Sabi pa nga ni kanina at Senator Bongo, pwede naman sila pumunta sa abroad, can afford. Pero sino po yung pupunta sa mga public hospitals? Ito po yung mga mahirap nating kababayan. So dapat po, pagandahin po natin serbisyo sa ating mga public hospitals and then make sure na yung mga gamot na kakarating sa kanilang tamang oras at hindi po nasasayang, hindi po nawawaldas. And lastly, dapat po yung mga naging pabaya, yung mga hindi po gumagawa ng tama, kailangan po talaga makasuhan. Again, for the end time, gusto ko po makita sa susunod sana na hearing with the indulgence of our committee chair sa health, I really need to see that record na meron pong nakasuhan na dun sa kapabayaan sa bilyon-bilyong halaga ng gamot na nasayang. Kasi so far po, puro press release lang na refund o ibinalik, etc. Pero wala pa rin akong nababalitaan na may nakasuhan. Kasi once nangyari po yan, napakitaan nyo ng record na may nakasuhan, then sasabihin po ng taong bayan na seryoso po tayo na para ma-address yung mga katiwalian sa ating gobyerno. Yun lang po. Maraming salamat po sa inyo. Mr. Chair, thank you very much, Mr. Chair.
Maraming salamat rin po, Senator Tulfo. Ito po ay nagmamahal sa ating mga OFW po. Salamat sa inyong partisipasyon, Senator Tulfo. So, let us now proceed with tapos na tayo sa Philippine Cancer Center. Punta na tayo sa Executive Department of Budget and Management, ASEC Cristina Clasara.
Good afternoon, Your Honor. Anyway,
Go ahead, ma'am.
okay, thank you. Consistent, sir, if I may now.
From Secretariat.
Start. Your Honor, if you can hear me, if I may proceed.
Go ahead po, ma'am. Go ahead po, Doc.
Thank you, thank you. For the DBM, we laud the noble objective of the subject Senate bills as it is geared towards the development of an equitable, primary care-oriented, and integrated healthcare system, which is the overarching goal of the Universal Health Act of 2019. The President has spoken, as mentioned by the good chairman, when the President, in his pronouncement in his persona, and with that, the DBM is in favor of the establishment of specialty centers in government-run hospitals. This will secure greater access for the poor, vulnerable group, and rural and remote populations to healthcare services, requiring specialized diagnostic, therapeutic, or rehabilitative services. This is in fact consistent with the Department of Health Department Order 2021-001 dated January 4, 2021, designating selected hospitals as specialty centers for lung care, renal care, and kidney transplant, cardiovascular care, etc. We find it more cost efficient and practical if we place the specialty center in the existing DOH hospital, and we find it more important. And more importantly, it is faster to implement if we do that, to place the specialty centers in the government-run hospitals. I think that's all for the DB. Thank you.
Salamat. May we now hear from the League of Provinces, Miss Angelica Sanchez. Wala na. Tapos na yung Philippine Medical Association. So sino pa bang online o gustong magbigay ng kanilang posisyon? LCP, BIR.
Good afternoon, Your Honor. I'm Attorney Uy from the BIR. Your Honor, basically, we do not oppose the tax provision. However, we find the tax incentive in the provisions are no longer necessary. The proposals are reiterations of existing provisions of their respective charters, mainly sa Philippine Heart Center, National Kidney, and the Lung Center. Also, the tax exemption, donors tax exemptions are also provided under the National Internal Revenue Code already, Your Honor. That's it, Your Honor.
Salamat. May question lang po ako sa ating mga specialty doctors, no? Baka andito rin po yung Philippine Medical Association, Ma'am, Doktora Maria. Andyan po ba kayo? Are you
Yes
still
po.
are you still online?
Yes po.
Baka pong pwedeng mapakiusapan natin aside from sa Philippine Medical Association, pakiusapan rin natin ng ating mga executive director ng mga specialty centers natin na yung mapakiusapan natin yung mga specialty doctors na pumayag po sila na i-charge ang professional fees, no, sa guarantee letter na binibigay sa natin sa kanila ng gobyerno, lalo na po yung mga totoong indigent talaga at galing pa po sa Mindanao at malalayong lugar. Madami naman po mga doctors na pumapayag na 50 to 100% na i-charge po ang professional fee sa guarantee letter. Konting tiis lang po, antay. Pero malaking bagay po ito sa mga pasyente na wala talagang pambayad, na umaasa po sa tulong ng gobyerno at ang iba sa kanila, pag may balanse pa, mangungutang yan, magsasangla, ibibenta yung karabaw, isasangla yung mga appliances nila para lang po may pambayad. Malaking tulong po yun kung mabigyan sila ng palugit o pumayag po na i-charge yung professional fee sa guarantee letter para makalabas sila ng hospital at hindi na ho kailangan mag-antay ng matagal, makauwi rin po sa kanilang mga pamamahay.
Your Honor, can I say something to that? Oo. We
Before-
had,
Sige po, mauna na lang po kayo, Dr. Joel, and then sasagutin rin po ni Ma'am Dr. Maria.
sorry, baka may...
Dr. Maria, na-address ko po yung
Sorry
question
for the
sa inyo.
interruption.
Pwedeng mauna na lang kayong sumagot and then Dr. Joel Abanilio will answer also.
Ipaparating ko po sa mga specialty societies ang inyong hiling po. Kailangan po na pag-usapan namin. Sige po. I'm sure marami sa kanila talagang pumapayag naman kasi lalo na yung mga specialty doctors na nag-work sa DOH hospitals. So, basically, parang ganun na nga po ang nangyayaring setup. So, ipaparating ko din po ang inyong hiling.
Salamat Dr. Maria Minerva Kalimag. Dr. Joel Abanilla.
This is about the GL. By the way, thank you for sending us your GLs. They are great help to our patients. But we have this issue. One time na-admit si Cha of DOH, our legal, si Attorney Cha. And then we were looking at this PF at saka ni-review namin ang guideline. The guideline says, kung GL galing, 50% lang ng PF ang makover. Kasi kung minsan may mga dumarating, malaki yung GL nila. They happen to get the support of a generous congressman or senator. Ang laki ang GL, pero hindi mabigay sa PF because the guideline says 50% lang. So why don't we extend it some more? Kung malaki naman yung GL, why not give more from the GL?
Sino hong gumagawa ng guidelines?
I don't know. That's the guideline we had. So hospitals. Sabi nga, this needs to be revised.
Can you take it up with ma'am? I'm addressing myself to the Department of Health who made the guidelines kung paano ba maging flexible dyan sa bagay na yan. Ang importante po rito, gaya sinabi ko kanina, basta yung mga mahirap na pasyente ang unahin natin ang makikinabang dito sa usaping yan. Pa-check na lang po natin yung guidelines. Naintindihan ko lang po yung mga doctors natin. Baka may guidelines lang sinusunod o bawal ganito, pero ang pakiusap ko lang naman po sa kanila konting konsiderasyon, palugit na kung talagang alam niyo naman gobyerno ang tagal ng bayad, pero importante mabayaran po kung what is due to them, what is due to our medical doctors, dahil services rendered rin po yan. Yung atin lang dito is paano mapabilis yung proseso, makalabas kaagad yung mga pasyente, yung mga mahirap na pasyente. Yes, sir.
Mr. Chair, pag service naman yung patient, wala naman talaga silang binabayarang PF, lalo na yung no balance billing. Ang problem lang po yung mga na-admit as patients, tapos because malaki na yung ginastos or naubusan na sila ng funds from the usual sources, sila yung nagre-request ng GL. At andun kasama na rin po yung PF kasi yung doctor nila, since pay sila, sisingil talaga po sila.
What do you mean by pay?
Private patients.
Private room.
Private room po
So hindi
sila.
charity.
Hindi po charity. Kasi charity, wala
Wala talaga.
walang PF po yun.
Hindi, ganito kasi yung kahit na yung iba yung kahit na considered na indigents, yung iba pa rin po ipili ng private, no? Kasi yung comfort nga rin po minsan, minsan pag nagpapa-admit na sila, bahala na, mamaya na lang tayo hanap ng paraan paano babayaran. So, kung talaga namang indigents talaga, at gusto lang nila ng konting comfort na sa pagpapa-admit nila, if proven na indigents, baka pag-aralan natin yung guidelines nga.
Sa amin lang po, pag pumayag po yung samaip or malasakit, willing naman po kami ibigay na 100% yung PF.
So, pag-aralan pa lang siguro ng mabuti. Merong nagsabi po rito na si Ma'am Xavier Ali Sukor, ating kapatid na Muslim, na discretion nga po raw ng doktor kung may mga pumapayag na i-charge yung professional fee sa guarantee letter or meron naman pong hindi pumapayag. So ang atin lang dito is pakiusap lang kung pasok naman siya sa guidelines if ever na pwedeng ma-charge nga po dun sa guarantee letter para ma-expedite at makalabas kaagad yung pasyente at hindi na mag-shell out yung mga indigent patients natin.
Your Honor, ang karamihan talaga na nag-GGL sa NKTI, 60 to 70% mga private. And this is true, no? In the past years, 60 to 70% private. Sabi nga naman, maski na si Dr. Duque noon nagsabi, kung talagang if you have a chronically ill, no, you're chronically ill, talagang maubusan ka talaga ng resources. So sabi niya, payagan nyo na lang din. Siyempre, papayagan mo, may GL naman eh. And discretion of the doctor again. May mga doctors talaga na ayaw, di ba? Pero kunyari, lumapit sa akin as the director, Doktor, paano to ayaw kumuha? Ako, sige na, kunin mo na lang, better than nothing. Di ba? So, I think nasa doktor na nga yun. Pero better than nothing. Matagal nga lang, no?
One minute, ano muna, gusto ko lang klaruhin, 1 minute suspension. No?
may MAIP. So, ginagawa namin ang paraan. Oh. Marami nang nangyari na ganyan eh. Kasi sa private sila nagpapa-admit. Tapos, wala pala pambayad. Mag-apply sila sa MAIP. Eh kung tingnan mong guideline ng MAIP, kung na-admit ka sa private, hindi ka pwede mag-MAIP, mag-medical assistance, unless ma-justify. Private room. Oo. Private room. Mr. Chairman, kasi kung as they have mentioned, kung na-admit na siya sa service ward, walang problema yan. Sagot lahat yan ng ospital o ng gobyerno. Pero if they are admitted in the private or pay section, yun, they have to shell out money from their pocket. Kaya lang iba, they use that as strategy. Wala naman talaga silang pera. So magkunyari na can afford naman sila, pa-admit sila sa pay kasi mas madali magpa-admit sa pay, mas mabilis. So medyo iba, learn the tricks na rin. Ay, pa-admit ka dyan sa pay, mabilis, admit ka agad. Tapos ayun, pag-discharge na, ayan. So kami, knowing na hirap naman mga kababayan natin, ginagawan din namin ang paraan. Meron din yan na initially private kasi can afford na rin. Pero sa gastos, exhausted na rin yung funds. Andyan naman sa MAIF guideline When that happens, they can now be perceived or considered as indigent. So pwede na rin sila mag-MAIF. Okay lang, justify ka na naman. Haba naman ng love letter mo. Kasi kung hindi, si COA na naman ang susulat sa iyo. Palitan na naman kayo ng love letter ni COA.
Salamat. So, clear na yung tanong mo. Sige po. So, wala na. Wala nang magpe-present na. Okay na tayo? Okay na tayo. Hearing resume. So, since wala na pong magpe-present, papasalamat po ako sa lahat ng resource persons for attending this hearing and sharing your insights physically at nasa online. Wala na pong magsasalita sa inyo. Maraming salamat po sa inyong pag-participate at sa pagtulong dito sa ating pagdinig. Ang bottom line naman po dito ay kailangan natin ilapit po ang serbisyo sa tao, mapa-specialty center or specialty hospital. Ang importante po, maramdaman ng ating mga kababayan na nandiyan po ang serbisyo ng gobyerno. Hindi na nila kailangan pang magpakahirap na pumunta rito sa Maynila para lang po magpagamot to avail ng medical services ng gobyerno. I'm so happy to learn na marami na pong mga specialty center natin na na-establish na po all around the country. Even before this hearing, meron na po palang na-establish kayo ng mga specialty center. Paano na lang natin dagdagan, palakasin pa. At the more we should invest sa ating healthcare system, lalong-lalo na po sa panahon ng pandemya ngayon na napakahirap mag-adjust habang nandiyan pa si COVID. Delikado pa talaga ang panahon dahil di natin nakikita itong COVID na ito. Magtulungan lang po tayo. Sino ba namang magtutulungan kung hindi tayo lang po, ang kapwa nating Pilipino, lalo na po para sa mga mahirap. We take note of the position of the DOH, our specialty hospitals, and our experts. The committee will be drafting the committee report to be sent to the stakeholders and relevant agencies for further comments. Kung kailangan po, magkukonsulta pa rin po kami sa inyo para paano ho natin makumpleto ng maayos ang ating committee report. Maraming salamat po sa inyong lahat. This hearing is hereby adjourned. Thank you.